Okay, got it. I think I started recording. Beautiful. Coming. Sorry, 1 minute. Okay, so good afternoon, ladies and gentlemen. I stand before you today with immense pride and gratitude as we gather for the inaugural Mission Brain University of Ilorin Conference. This event marks a significant milestone for us as we embark on a journey inspired by a vision of bridging the gap in neurosurgical expertise in undeserved areas. Mission Brain Foundation is a non-governmental organization founded in the United States under the visionary leadership of Dr. Alfredo Quinos Shinojusa, and the organization is dedicated to providing neurosurgical expertise to undeserved regions worldwide. Mission Brain has transformed lives across the world, and today we proudly establish the first chapter in Nigeria, right here at the University of Ilorin. Our journey began with the Glial Initiative, a name inspired by the glial cells that supports and protects neurons, just as we aim to support aspiring neurosurgeons. The initiative was born from a dream to address Nigeria's critical shortage of neurosurgeons and reignite interest in this life-saving specialty among students. In response, research opportunities were initiated to sustain this passion, envisioning a community where individuals could develop a keen interest in neurosurgery. The aim is not only to nurture the dream, but also to contribute to increasing the number of neurosurgeons in Nigeria, recognizing that students' perception and knowledge significantly impact their career choices. We believe that knowledge is power, and to empower aspiring neurosurgeons, we aim to provide access to information on global opportunities, the importance of research, effective networking, and the significance of mentorship. This event is the first of its kind in Nigeria dedicated to neurosurgery, but rest assured, it won't be our last. Stay tuned for more impactful events in the future. Beyond conferences, our initiative extends to outreach programs designed to reduce the incidence of neurological disorders in Nigeria. While we may not perform surgeries as students, we can raise awareness and support the shortage of neurosurgeons in our country. As we embark on this journey, I invite you to join us. Together, we can transform the landscape of neurosurgery in Nigeria. Let's empower aspiring neurosurgeons, bridge the gap in undeserved communities, and reshape the future of brain health. Thank you all for attending, and I wish you all the best. Thank you. I'm done, Dr. Bankole. Over
Thank you very much, Mubarak, for your kind welcome speech. And once again, welcome to everyone. I am Dr. Bankole, I'm a neurosurgeon originated from Benin. It is a pleasure for me to have the opportunity to moderate this session of afternoon among my senior colleague who will give us a short moment for a talk. Please, I think that we should start in less than 20 minutes with the speaker. Just give you a reminder that please fill the survey that you have in the WhatsApp group for those who is in the WhatsApp group. For those who is not please, Mubarak, if you be able to
Yes,
use
I'm going to
just
send it
send
now.
me.
I'll send it now. Thank you very much.
Perfect. So please send that, then people will be able to fit that. And as well, I think that normally Dr. Aziz, but Dr. Aziz is here. Please, you ready? So after I will announce the first speaker, please you will be able to read short biography to see how much impactful speakers that we invite for our event of this afternoon. So please be ready when I will tell you, you be ready to present the first speaker that is telling about you.
Yeah, Aziz, please send your check your DM.
Over to you.
Yes, I'm going to send.
Perfect.
I'm going to send the survey and the form.
Perfect.
Should listen in Nigeria. Just listen a little bit. You have fun.
I'm sorry. I want to send the link now. I'm sorry for the delay.
Okay. Perfect.
Yeah, and I feel after I share the link, we can just have maybe participant introduction or something, so that we can know where everybody's from, connect with everybody before our speaker arrives. So I've sent the WhatsApp link, please. If you haven't joined, join, because the other information is to be passed post events. Thank you. And I've also sent out the pre-conference survey, just like Dr. Bankole reminded us. So it's compulsory to fill it, please. So kindly start doing that before saying those. Thank you.
Thank you. Over to you guys. Please, those who is not communicating, unmute yourself. Otherwise, please, the host should unmute everyone, please. Only the speaker have the right just to mute the microphone. Unless you want to say something, you can put your hand up. We will give you the talk to unmute yourself. So, please. Thank you.
We have the introductions now. Maybe everyone can just type on the chat. If that won't, distract people from seeing, the WhatsApp group link and the survey.
Kilo sent.
So much started already, which is amazing. So like everyone here, so that we can get to know each other, network with each other, which is also of the importance of events like this. Can we just type our name, perhaps institution, where we are joining from? Please let's type our name. Thanks.
Root services. Too terrible.
I can see Umul Khair. Welcome, Umul Khair. It's great to have you join us all the way from Bayero University Kano. Okay, I can see Gully Thomas from University of Ibadan. Great to have you here. Folaromi Islam, medical student, University of Abuja. Wow, all the way from Abuja. Beautiful. I can see Mom Abubakar, University of Ilorin. I can see Timofari Abdulkadir, University of Ilorin, Suleiman Ahmad, University of Ilorin. Perhaps it's because it's Ilorin event. That's why we have University of Ilorin dominating. That's amazing. Please, let's keep it coming. Thank you. Williams Ajayi, University of Ilorin, Victoria. Let's all mute ourselves, please. Victoria Ogundiran, Cohen University. Yunus Muideen, University of Abuja. Yale University of Kenya. We have Sarah, Lagos State University. Wow. Abdulwakil Zaria, ABC, University of Ilorin. Suleiman Abdullah, UITH. Wow. That's beautiful. We have several individuals from different places. I'm sure we have more guys. Please, let's keep coming. Okay, Chikudi Esther from University of Ilorin. Okay, let's continue, please. Dr. Esen will be joining us soon. Okay, Abdurrahman Awal, University of Ilorin. Wow. We have in a bit, Laura Conte, University of Ilorin. Okay. I'm also introducing myself. I'm from University of Ilorin too. We can connect. We have Mogaji Abdulaziz from Lagos University Teaching Hospital. Wow, beautiful.
My name is Masoud Haruna Isa from Bayero University, Kano.
Yeah, thank you very much, Masoud. It's great to have you here. Please, let's feel free to connect to network with like minds. We can work on research together. Okay, Abraham Israel, University of Ilorin. Wow, nice. We have Dr. Mustafa Fati, University of Ilorin. We have Karim Aminat, University of Ilorin. Wow. I equally can't wait to learn from the amazing specialists that we have speaking with us together. We have Fudusho Akinwadi, University of Ilorin. I think I'm already networking with final year students to say that I'll chop plenty in doctoral rice. Olani Mariam, University of Ilorin. Welcome, everyone. It's great to have you here. Please, for those that are just joining, I will resend the survey link and the WhatsApp group so that we can join and further information will be passed post event. Please, it's important. So let's just try to fill the survey before Dr. Essen joins us. He's going to be joining us in less than 10 minutes, according to the schedule. Hey, we have more people. Wow. Hey, Kai said we should connect with her on LinkedIn. Umokari Ibrahim, research enthusiast. Wow, I also love research. I'll connect with you so that we can do projects together. Thank you. I think we can also post the link so that we can just connect at once. I think that works. I'll post mine now. We have Emmanuel. Wow, finally. We have Julia Kwakwi from Botswana. Wow, welcome. We have Rihanna from Bolivia. Wow, welcome. Okay, Umulkai sent her LinkedIn. Let's do well to connect with her so that we can do research projects with her. I sent the WhatsApp link, please. Let's do well to join the group. I think some people are yet to join the group. Thank you. I've sent the survey also. Still it if you haven't. Thank you very much. I think will be joining us in about 5 minutes. Yes. Yes. Okay, so I just spoke to Dr. Essen, and he said he's joining us now. Please, if you are just joining, kindly introduce yourself on the chat. Join the group with the link I dropped. Fill the survey also, please. It has to be filled before the program starts, unless it's not valid again. The survey will be closed soon. And perhaps whatever benefits you're going to be getting from this conference, unfortunately, apart from the knowledge aspect, any post-conference benefit won't be applicable to those that didn't fill the survey. So that's why you have to fill it now before Dr. Essing's session starts, because the survey will be closed anytime from now. Thank you. Okay, I think we have Dr. Etienne with us now. Dr. Bankole, over to you. Thank you very much.
Okay, thank you very much. So it is a great pleasure for me to honor to have Dr. Etienne Ignatius among us this afternoon to give a lecture. Welcome, Dr. Ignatius Etienne. Please, Dr. Aziz, could you kindly give a short dissertation regarding Dr. Ignatius' biography, please? Over to you, Dr. Aziz.
All right, thank you very much, Dr. Bankole. It's a pleasure. I'm Dr. Aziz has introduced, or as I like to introduce myself, I'm Abdullah Aziz Morgaji. And then it's my absolute pleasure to welcome Dr. Ignatius N. Essen. I hope I pronounce the name just as right. Dr. Ignatius Essen is a distinguished Cameroonian neurosurgeon and a scientist who stands at the forefront of neurosurgery with an impressive academic journey. Holding 2 doctorate degrees, 2 masters, a postgraduate fellowship, and 5 postgraduate diplomas, he showcases a remarkable commitment to excellence. I hope you can hear me. Dr. Essen's educational path led him from earning his MD degree in Cameroon to achieving a magna cum laude in Masters of Public Health in Brussels through a scholarship. His residency in Cairo resulted in a master's in neurosurgery/neurology, where he finished cum laude, and a doctorate degree in neurosurgery under the auspices of the World Federation of Neurosurgery Sciences. Dr. Essen is a multifaceted expert. He holds postgraduate certificate in health economics, international health, advanced research methods, pediatric neuro-oncology, skull-base and neurovascular surgery. He has garnered numerous accolades, grants, and scholarships a testament to his exceptional contributions. Currently, he is currently serving as the secretary of the Cameroonian Neurosurgery Society and chair of the WFNS Young Neurosurgeons Forum. Dr. Essen is also a FIANS board member. His editorial roles include the deputy editor-in-chief of the Journal of Global Neurosurgery, editor in major neurosurgery journals, and authorship of over 150 scientific publications, reflecting an AH index of 18. In addition to his impactful leadership and editorial roles, Dr. Essen's commitment to knowledge dissemination is evident through his participation in over 250 international conferences and meetings. As a consultant neurological surgeon and a public, international, and global health physician, he continues to shape the landscape of neurosurgery with expertise, dedication, and a profound impact on the field. Ladies and gentlemen, please permit me to welcome to the podium, to our virtual podium, Dr. Ignatius N. Essen, a distinguished and accomplished all-rounder neurosurgeon. Please let us all have him. Thank you very much. As we have the person.
Yeah, thank you so much, Abdulaziz, for this kind introduction. I think there's some noise in the background. I think you need to mute those who are not speaking. Yeah, so
Yeah.
happy New Year to everyone. Thank you, Dr. Mubarak, for inviting me. I think I've already seen a few people on the panel. I mean, like Dr. Nurizin, whom I've known for more than 5 years now, and I'm so happy to see him on board. I think, you know, he's a rising star in Africa, and I'm so happy that, we're moving the same direction. So without much ado, I'm going to share my slide. I think we'll spend most of the time discussing, you know, we just finished from vacations, and let me see, just 1 minute, let me share the slide. Okay, are you able to see my slide? Hello?
Yes, sir, we can see it.
Yes.
Okay, thank you so much. So I was asked to speak about global health opportunities in neurosurgery and neurology. Well, you know, my background is in neurosurgery, and so I feel much more comfortable talking in that domain, you know, because, you know, surgery is a very large specialty. Global health is also another field of medicine, which is also very broad. So sometimes we need to focus on the things we master most, so that, because the details are, the devil is in the details. So I was talking about opportunities in global neurosurgery and global neurology. There is no conflict of interest in the materials I'm going to present here. Most of these materials are things we've worked on and published. So, you know, to talk about global surgery, to talk about global health, I would like to make it much more practical by illustrating a case to show us the loopholes, the gaps we are having in making global surgery a reality. So this is a case of a patient that came to me in the early 30s, road traffic accident, fell from a bike and hit his head on the tarred road. So he sustained an injury here on the frontal part of the head. I believe everybody here is a medical doctor otherwise, but this is the frontal part of the head. So the patient lives very far away from the hospital, about 400 kilometers. So he was first of all hesitant to come to the hospital because, you know, in our settings, the patients coming to the hospital. So he finally, so while in the hospital, sorry about that. Sorry, I really apologize. So while in the hospital, because of some of the challenges, maybe doing a CT scan, getting money for surgery, so it took him up to a month. So we begin to ask the question, our patients, are they getting optimal care? In other settings, this kind of case, when the patient comes to the hospital, the surgery is done within a few hours. So is the mission of global health fulfilled? Are we providing safe, affordable, and timely care to our patients? Is there equity in the provision of healthcare to our patients? So these are questions we start asking ourselves in our environment. Okay, because when you compare to other settings, things don't go this way. So we know surgery is always described in the Lancet Commission report as a neglected stepchild of global health, because for over the decades, when reference was made to global health, they used to talk about communicable disease and non-communicable diseases. So the commonest communicable diseases were infectious diseases like malaria, tuberculosis, HIV. Because if you talk to somebody out of Africa or out of sub-Saharan Africa, the only thing you might likely relate to the health situation is talk about malaria, tuberculosis, and HIV, and then non-communicable diseases like diabetes and hypertension. So, but this is beyond these pathologies, because the burden of surgical disease in our environment even surpasses that of these pathologies put together, and surgery becomes a very important component if we need to build resilient and strong and functional health systems in our setting, especially in Africa. There's some noise in the background. So to be able to build a strong and a cost-effective health system, okay, we need to involve or integrate the management of neurological diseases or neurosurgical diseases. Okay, and it has been well reported. I think most of the presentations or most of the talks on global health always underscore this fact that up to about 5 million neurosurgical cases are not treated because they go untreated, because for various reasons, just as the case which I illustrated. Some might not even want to come to the hospital, but some come to the hospital because of lack of resources. They might end up not getting the treatment that they need. And an additional 23,000 neurosurgeons are needed because there's a deficit in the workforce, especially in our settings. And most of the diseases that are in need of treatment are diseases in the field of the neurological sciences. They have traumatic brain injury, which is very common, especially with the advent of the motorbikes. I think if you go to most African countries, even in major cities now, you see people don't use, people use more and more of motorbikes, and without wearing the protective devices, they expose themselves to traumatic head injury. We have stroke. The stroke is becoming very common because of the change in the lifestyle. Hydrocephalus, which remains one of the commonest cause of consultation in neurological sciences. Tumors are becoming much more important because of availability of diagnostic tools, CT scans, MRIs, okay, which are readily available and affordable to most of the population in Africa. Epilepsy, which used to be considered maybe something related to witchcraft, is now being related to medical causes. So most people are now getting to hospital to get treated. Well, infections are decreasing with time, but as I mentioned before, people used to think that when you talk about disease in Africa is equal to infections, which is not the true story of our continent. And in a recent report from the disease control, surgery was underscored as an important aspect of the health system, and it was emphasized that in certain maybe at the level 2 and level 3 levels, we should be able to perform basic neurosurgical procedures like burr holes to save people from common pathologies like chronic subdural hematomas, maybe do shunt operations. So we don't necessarily need to have a neurosurgeon to be able to do these pathologies. And in the high centers, we should be able to perform advanced surgery. However, because of limitations in resources and workforce, provision of neurosurgical care to our patients is still a far cry. So there's this slide I always show in most of my presentation because when I conceive it, I try to imagine the way healthcare is delivered across the world. On the left is what we find in high-income countries, and on the right is what we find in low-income countries. Ideally, we should be able to, a doctor or a medic in the hospital should be able to provide care to the patient, which is our primary mission, okay? But for this to be optimal, they need to be involved in continuing education, training of future generations, and involved in research, because with the advent of evidence-based medicine, if you don't practice it, sometimes it becomes difficult. You need to sometimes make decisions based on your opinion, which might not be ideal to providing optimal care to our patient. And the situation is much more acute in the developing settings. But one thing which has been neglected, especially in our setting, is the concept of global health, and which all of us need to integrate into our practice. And I think if you go to maybe North America, most of the doctors there, they get an additional training in public health, in international health, or global health, in addition to their basic clinical training, because we need to be advocate in our specialties. Nobody knows what we're doing. If we don't tell people what we're doing, they're not going to understand what we are talking about. Musicians, they go to the media and talk about what they're singing. The football players, they do a lot of publicity. But in healthcare, sometimes when you want to talk about what you do, people feel that maybe you are trying to maybe promote yourself, which is not correct. Medicine has always been mystified. So we need to make people understand the challenges and the difficulties we have so as to provide optimal care to our patients. Emmanuel, can you mute your microphone? So talking about our talk today is about global surgery, global neurology. So what is the scope of global surgery or global neurology? There's this paper which I wrote with one of my junior colleagues about the different ways in which global health has been looked at, or global neurosurgery specifically, when we refer to the field of neurosurgery. Because before, people used to maybe refer to global neurosurgery as missionary trips to developing countries, when people live from high-income countries to low-income countries to assist or help them, give them aid. They call it global health. But this is far from the definition in which is much accepted across the world, which is global health is defined, or global surgery is defined as the clinical and the public health practice of healthcare, okay, with the goal of providing safe, affordable, and timely healthcare to people in need. So this definition is very holistic because it removes that the stigma, which which was in the old definition, where people used to look at global health in a perspective where people who are maybe say in the rich countries come to help people in the poor countries. So global neurosurgery is the clinical, the public health practice of neurosurgery, okay, with the help of to provide safe, affordable, and timely neurosurgical care to people in need. And so therefore there are two components. There's a clinical component and then there's a public health component. So the clinical components are what? Management of patients having maybe a head injury, or so what we call neurotraumatology. Somebody's having maybe a problem with the blood vessels in the brain, or neurovascular surgery. Somebody's having maybe problems at the level of the floor of the skull, okay, skull base. If somebody's having a tumor, can be it benign or malignant, talk about neuro-oncology, okay, and then infections will be them, which can be parasitic, viral, bacterial, and so on and so forth. And then when you're dealing, one of the field which is also becoming very frequent is the field of pediatric neurosurgery, because if you look at the sustainable development goals, particular attention is paid to the children and the women. So therefore, another aspect which is very important, clinical practice is the aspect of clinical. You also have a functional neurosurgery, etc., etc. When you go to the public health practice of neurosurgery or surgery or medicine, you are definitely looking at the building blocks of a health system, because the WHO, the World Health Organization, has actually defined what we call the structures or the blocks that make up an ideal a health system. Okay, one of them is the manpower, the human resources. If you don't have people who have to work in the system, then the system cannot be functional. So we need to have people who are ready to work, well trained, skilled, to provide the safe, affordable, and timely care to the patients. Another aspect is when you have information and technology, you have financial resources. You need money. Without money, nothing works. You need to pay people working. Nobody's going to work for free. We need financial resources. You need service delivery, management of personnel, governance, and so on and so forth. So these two together are the two components of global surgery or global health. And we need to, for the system to be optimal, for us to be able to provide optimal care to the patients, we need to integrate these two. Because traditionally, people just used to focus on the clinical aspect of healthcare, and it didn't actually work. That partially explains why for over 50 years, since most of the African countries have been independent, our health system has not evolved very much. If you go to other settings where they integrated these two aspects, they've gone very far. And that's why we always get people getting health evacuation to go to these countries. So we need to put together these two components to be able to provide adequate care to our patients. For me to illustrate the different opportunities that we have in neurosurgery, global neurosurgery, I'll use the example of Cameroon, which is my country. Okay, again, in this paper which we published a few years back, evaluating the situation in Cameroon when I just returned. So Cameroon is a country found at the hinge of Africa, okay, here is Central African Republic, Central Africa, with a population of over 25 million, okay. I was working here in the northern part I'm still here, and this part I was, before I was here alone, other neurosurgeons have been posted here now. And I teach in the university in the northwest part of Cameroon. So neurosurgery in the northern part is still nascent, it's still at its gestation. Similar to Cameroon, neurosurgery is still in its developmental phase. So we evaluated the situation of Cameroon to understand how neurosurgery is being practiced, to understand the challenges, to understand the resources which we have, to understand the financial resources, the human, the workforce, how healthcare is managed. So again, the building blocks of the health system, and to make you understand the opportunities we have, we will go in looking at the first block, which is the clinical aspect of practice of neurosurgery, and then before we go to the public health practice of neurosurgery. So if you're interested in global neurosurgery, global surgery, or global health, then you have to choose one of the areas in which you want to work with. You can pick one of the clinical aspect or one of the public health aspects and focus on it, because I always say, if you want to fail in life, try to do everything. Try to make an energy divergent. If you want to succeed, be focused. There's no, but the time we have on earth is very limited. So we can't basically do everything. So for example, if you want to, there's what we call global pediatric neurosurgery. Okay, so we have global surgery, global neurosurgery. So now we have gone to global pediatric neurosurgery. So somebody who wants to look at the clinical and the public health practice of pediatric neurosurgery, then you will talk about global pediatric neurosurgery. If you want to focus about the infections, you talk about global neuroinfectiology. Okay, if you want to talk about want to focus on spine, okay, you can talk about global spine surgery. You want to talk about trauma, okay, global neurotrauma. So these are different areas where you can actually focus on. Okay, so again, as I said, Abdurrahman, please mute your mic. Yeah, so these are the different windows which are open for us to focus on, because essentially we can't do everything. Yeah, it's true, we can do general neurosurgery or general surgery, but at one point, if we need to create an impact, we need to start advocating for something, then we need to choose one thing and talk about. So I think somebody like Bankole, he will tell you, when you start your training, you start practice as a neurosurgeon, most of the cases you're going to see will be maybe neurotrauma and spine. So you can start advocating in neurotraumatology, so global neurotrauma, or spine, global spine surgery. So you try to look for ways in which we can solve the problem related to traumatic head injury, traumatic spine injury, or the way you can the way you can manage degenerative diseases of the spine. So by so doing, these are the different windows which we have with respect to the clinical practice. So global neurosurgery does not only concentrate on the building blocks of the health system, it integrates the clinical practice, which I just illustrated here. So you can pick, if you are focused on spine surgery, so you can become an advocate of spine surgery. So you talk about global spine surgery. So you look at which pathologies in spine are very common. So we know degenerative disease. Almost everybody at one point in life is going to the spine is going to degenerate. So we are not going to wait for the patients to come to the hospital for us to treat them. We need to look for ways to prevent this to happen. So you look at the public health practice of it and look for ways in which this can be done. Talk about trauma. If you want to become an expert in global neurotrauma, how do you proceed about it? You look in your environment. You can first of all do a study to understand what are the different causes of head trauma. Maybe before the patients arrive in the hospital, which is the pre-hospital causes. You look at what happens to the hospital, the patient when the patient reaches the hospital, and what happens to the patient when he gets out of the hospital. So talk about pre-hospital management of trauma, hospital management of trauma, and then post-hospital management of trauma. So when you look at these, you can then look for measures how you can actually solve these problems. So in that case, now you are then looking at it now from a broader perspective. If I stay in the hospital waiting for the trauma cases to come to me for me to operate, I'm just looking at it from the clinical perspective. But if I want to really actually solve the problem, I need to go and look at the people, at the bike riders having the helmet. Are they well trained? Because sometimes you just get, especially here, for example, in Cameroon, somebody maybe he has been saving money for over a year. By the time the money reaches a certain level, he gets a bike, goes to maybe a football field, turns there twice. It goes to the road, carrying passengers and exposing everybody, to dangers of head trauma. So we need to be able to look at those causes, or those risk factors, those things that are going to lead to problems that are of public health importance, and then try to provide solutions to them. In that way, we are looking at the global health from the clinical perspective. Now, when you look at it from the public health perspective, I'll take example of Cameroon. When I returned, I wanted to know the kind of patients that I'm going to be treating. Okay, so we did a situation analysis to understand what is happening in Cameroon. We realized that up to 40% of the cases in Cameroon are trauma. So I needed to understand that. For example, I need to go and read Brain Trauma Foundation guidelines to keep myself abreast with the current management of traumatic brain injury. I need to investigate. So most of my research now has been focused on Jiwa,
I
please.
think this one.
Yeah. So most of amongst the neurosurgical pathologies in Cameroon treated by neurosurgeons, 40% are trauma. So you see that trauma is what the major problem. So I started working with a lot of teams. I worked with the Cambridge team on trauma. I worked with the Colombian team with Andreas Rubiano. So I then started getting an openings in global neurotrauma. I was then recruited into the global neurotrauma committee of the WFNS because I know. Please, can you mute everybody, please?
Timothy, please, can you help me out? Thank you.
Okay.
I think everyone is muted.
Okay, that's fine. Yeah. So I was saying, I was saying to be engaged or to know the opportunities you have in global neurosurgery or neurology, global surgery or global health. You need to look at global surgery or global health from two perspectives: the clinical practice, which was the traditional way of looking at it, and then the public health practice of global health or global surgery. So I just spoke about the clinical aspect, which is the traditional way in which neurosurgery has been looked at. Now, the most recent way is the combination of the traditional practice, looking at the different pathologies which we have, and then integrating the study of the building blocks of the health system. So, for example, I'll give an example of this situational analysis which we did when I returned to Cameroon. So we analyzed and understood that 40% of the practice is going to be on trauma. So I needed support to be able to manage my patients adequately. So because I knew already that at least about half of my patients that I'm going to receive are going to be trauma cases. So I get myself affiliated to people that have so much experience in trauma. For example, the Cambridge team with my friend Angelos, who was the chair of the WFNS Young Residence Committee, with Andreas Rubiano in Colombia, and other trauma teams. So I got myself invested in trauma because this was where I'm going to be useful. It's true, maybe I did a fellowship in neurovascular, but on returning, I was not going to practice neurovascular because I need to have a good system for me to be able to do aneurysms and do other vascular problems. Again, and then we analyzed to understand the situation of Cameroon in terms of workforce. We realized that the number of neurosurgeons in Cameroon is very limited. We had just about 25 neurosurgeons, and most of them were located within the economic and political capital. So I was in the northern part of Cameroon here alone. So I needed to cover a very large area, and some patients coming from nearby countries. Again, this is another aspect which you can work on. So when you discover that there's a problem, so what do? You need to inform the policymakers that, oh, there's limited workforce in this part of the country. There's a need to train more people. There were no complementary staff. So I need to inform the Ministry of Health that though we don't have enough complementary, that is neuro anesthesia, there's no new nurse in the theater that is specialized in neurosurgical procedures and so on and so forth. So therefore, we organize local training courses. And this is what we talk about global neurosurgery. But global neurosurgery is not just about writing papers and publish. No, you need to put into practice what you're preaching. Infrastructure, well, infrastructure doesn't depend so much on you as an individual. When we analyzed the situation in Cameroon, and by then there was no advanced center for neurosurgery, and most of the CT scans and MRIs were again located in the economic and political capital. It's true, the Cameroon government made an effort to build a center which was destined for neurological sciences. It was supposed to be purely for neurosciences. It's true, it was converted to a general hospital, but again, the mission is still for neurosurgery, which is also a good starting point. We realized that also with respect to service delivery, we didn't have a good referral, counter referral system. So we had just one referral center in the political capital. So we've been telling the government that no, there's a need to have trauma centers at the different regions. We've not yet had that in practice, but I think in the coming years, the government is going to do that. So by then, these are opportunities for me as a young neurosurgeon coming into my country. I detect the problems, I inform the policymakers, and we work together to provide solutions. Okay. Another aspect was about the finances. We realized that just about less than 20% of our patients had a health insurance. We know, for example, to treat a neurosurgical patient, you need that kind of maybe $1,000 to $2,000 US. I mean, that's the minimum to provide maybe basic surgery for maybe hydrocephalus. When this insurance is not is absent, how do you provide care to these patients? So the government is trying to put in place universal health coverage. When we hope when it's going to be effective, it's going to maybe ensure that patients have safe, affordable, and timely healthcare. Another aspect which we realized that in most of the hospitals, there were no data, there was no electronic databases. Again, this is an opportunity for a young neurosurgeon like me coming to the country. I inform the health policymakers. We need to have electronic databases. How do we understand what is happening in the country if we don't have data? Again, so from these two slides, the previous slide which I mentioned showing the clinical practice of neurosurgery, and then this slide which shows you the public health practice of neurosurgery, I'm able to bring out the problems which I face in Cameroon, and then the windows which I have now to get involved in global neurosurgery. Sorry, slide. Okay, so we cannot just act in isolation. I cannot sit in Cameroon and try to practice global neurosurgery without maybe getting myself aligned to the big picture, which is the global picture. So I try to also maybe look at what is happening at the global stage. This is what we call the Global Action Plan, which was developed by the World Federation of Neurosurgical Society, that actually defined the direction in which global neurosurgery is actually taking. And in this global action plan, they talk about the 5 A's. The first of which is talk about amplification of access to neurosurgical care. Okay, I'm not going to go into the details, but I'm just going to maybe list the different aspects. Somebody can go to the website and then get more details. The other aspect was make sure that the things I'm doing locally should align with the global activities, because if the things you are doing locally within your region or your country do not align with what is happening across the world, you won't get support, you won't get funding, so you won't succeed. So you need to make sure that the activities you're focusing on are in line with the global activities. For example, I told you you realize that up to 40% are trauma cases. Okay, and we know neurotrauma is a public health problem, it's a global health problem. So most of the institutions are putting a lot of resources into management of trauma cases. A lot of research is going on in trauma. So I have to align my activities locally in Cameroon to what is happening globally. The other aspect is about advancing relevant research, especially from low-income countries. This is a key objective, and this is one of the aspects in which I've been very much engaged in and very active in advancing research, because again, I think Bankole will testify to you. For a very long time, Africa was just like, can say, the laughingstock of the world. In a paper that was published some time ago, Africa was contributing just to 0.3% of global research in the field of neurosurgery. So again, you see that this is a problem. So, but you can't solve this problem alone, because to do research, you need resources, you need heavy capital. So you need to align yourself with global forces to be able to make sure that this is done. Because, for example, in Africa, you don't even have a journal. So even if you succeed doing the research, where do you publish your paper? So you need to align yourself with the major mainstream journals so that the work you do is actually given the visibility it deserves. Okay. We need to be ambassadors of what we're doing. Okay, we need to join the policymakers, our governments, to advocate for universal health coverage. As I mentioned before, less than 20% of our patients had access to healthcare financing. So for us to be able to solve this problem, it may not happen now, but at least the goal of our in life is to ensure that things are progressing. So maybe people coming after me might benefit from this, but we need to start working on it. Because you cannot say, I mean, like, this is something which is going to take a long time. No, you have to work on it and ensure that we make sure we need to make sure that to assimilate the surgical capacity building, okay, in our system. So as I said before, we need to train people that are working with us. Sorry, we need to nobody's having a sorry, somebody's. So we need to train people that have to assist us to achieve our goals. We need to go to the world. Trainers know how to do dressing, wound dressing. We need to make sure that if we don't have the anesthesists that specialize in neurosurgical anesthesia, we can maybe train the nurses that are available to assist us to do basic surgery, because most of the time, these people are sufficient for us to help us assist our goals. So again, so when you look at the clinical practice of neurosurgery, you integrate it with the public health practice of neurosurgery, you make sure you align your opportunities with the global vision, then you are going to be able to achieve some results. Again, as I told you before, one of the aspects which I've been focusing on, which is an opportunity for young neuros in the continent, is the aspect of research, because research is a big issue in the continent. We are publishing very little, and if you take a situation like in traumatic brain injuries, where most of the guidelines, most of the research is coming from high-income countries, and this evidence and the guidelines produced have to be applied in Africa, then we need to work hard to provide evidence which has to be integrated in the development of future guidelines. So therefore, we need to invest a lot of energy in doing this. Again, I'm not going to go into the details. If you go to the website of the WFS Global Neurosurgery Committee, you'll find all this. So there are so many opportunities for people who are interested in global neurosurgery and global health. Okay, you can look at it again from two perspectives. You can choose to focus if you're somebody who is not very interested in the public health practice of health or surgery or neurosurgery. You can focus on the clinical aspect. On the clinical aspect, you look at the classical pathology, which we see: infections, trauma, tumors, vascular pathologies, okay, infections. You can focus on spine, pediatric pathologies, okay. But if you're somebody who wants to be much more broad, who wants to create much impact, then you need to integrate the public health aspect of management of patients. Now you have to look at the building blocks of the health system, from manpower, from money, from material, information management, finances, governance, and so on and so forth. So maybe now global health is a subspecialty, okay? Global surgery is a specialty. Global neurosurgery is a specialty. So if you are keen on becoming a global health expert, if you are keen on becoming a global neurosurgery expert, then you can take a master's, you can do some diploma courses, you can do a certificate courses, okay? So if you go to the website of the World Federation of Neurosurgical Societies, you'll find courses on global neurosurgery. If you go to the website of the World Federation of Neurology, you'll find courses on global neurology. In neurosurgery, for example, you have the program in global surgery and social change, which is in Harvard. You have the Duke Global Health Program. So most departments of neurosurgery now have global neurosurgery programs. So you just need to maybe write to one of the program directors, and they're going to maybe lead you to studying and getting a certificate or diploma in one of the projects. I'm sure somebody has hacked the website. Okay. Thank you so much for your kind attention. I'm waiting to get your questions.
Thank you very much, dear Dr. Ignatius. It is a pleasure and honor to have you. We was together just, I think, 2 weeks, 3 weeks ago in Cape Town. I hope everything is going well with you. I'm very glad to have you among us, and very nice talk that summarize a lot of points. I don't know if we have it. I think we will have 10 minutes of discussion before to move to the next speakers. If you allow us, Ignatius, if you agree, we can open the panel, the question for the participant.
Yeah, thank you.
Perfect. So please, dear participant, if you have a question, you can tap that in the chat, or you can raise your hand and unmute yourself, and you can ask your question. It is an insightful talk of Dr. Ignatius.
I think we can type it on the chat box.
Okay, perfect.
And
so
maybe
let's
There's a guy called Aaron. You need to remove him. I think he's hacking. Aaron, please take him off.
Okay, let me check.
Simboti, can you help with that, please? Thank you.
Aaron?
I think the person has left, actually.
Yeah.
I was also targeting the person.
Okay, perfect. So let's move on,
Let's
please.
drop our questions. Or no questions?
Okay, so let's move on to the next speakers. If it is already there, could you confine to me, Mubarak, that the next speaker is already?
Professor Bankole is around already.
Oh, perfect. I'm very glad to have Professor Bankole among us. The last time I saw him, it was in Abuja, during the Cannes Congress in Abuja. I think, no, it is Dr. Raji who gave me the prize. It is not him, but we meet and we discuss, and it is a great and giant neurosurgeon of Nigeria. I will call Dr. Aziz again, please. Dr. Aziz, could you give a short bio of Professor Bankole, please? Dr. Aziz, are you there? Dr. Aziz?
Yes, I'm here. I am here, please.
Okay, please, could you present to us a short bio of Professor Bankole?
All right, thank you very much.
Professor Bankole, you can start to share your screen. Thank you for joining us.
All right. As I introduced, Abdulaziz Mogaji, and it is my utmost pleasure to read the citation of Professor Femi Bankole. Dr. Femi Bankole finished from the medical school of the Obafemi Awolowo University, Ile-Ife, where he was on the dean's list. After internship and national service, he pursued his desire for specialist training in neurosurgery at the Lagos University Teaching Hospital in the year 1995. Can you hear me? Are you all with me?
Yeah.
All right.
Yeah, go ahead.
Dr. Bankole completed the residency program in 2002 and was awarded the fellowship of the West African College of Surgeons.
Shut up, nigger.
After receiving his fellowship, he had further training in several internationally acclaimed hospitals, including the Emory Clinic, Atlanta, Georgia, the Cure Children's Hospital, Uganda, and the Mayo Clinic, Rochester, Minnesota. As a consultant neurosurgeon, Dr. Bankole has blazed the trail in neurosurgery care and has been involved in the training of neurosurgeons in the past 20 years. His stated objective is to further develop the practice of neurosurgery in Nigeria with special regard to improving the quality of and access to neurosurgical services throughout the country. This vision has resulted in training of specialist manpower who work in many states across the nation and abroad. Since 2003, he has worked at the Lagos University Teaching Hospital, Idiaraba, Lagos, as a consultant neurosurgeon, and his passion has been to increase the scale and level of neurosurgical practice, not only in Boots, but across the Federation. Dr. Bankole also holds an academic appointment in the Department of Surgery, College of Medicine, University of Lagos, where he is an associate professor and head of neurosurgery. Dr. Bankole is passionate about giving back to the community and has been involved in several medical missions to countries in Africa and Southeast Asia. He is also involved in mentoring the next generation of Nigerian leaders and has served as a facilitator on several fora for mentoring young professionals. He is currently the president of the Nigerian Academy of Neurosurgical Surgeons. Ladies and gentlemen, please permit me to welcome to our virtual podium once again, my teacher and consultant, Professor Femi Bankole. Thank you very much, everyone.
Yeah, please, Timothy, can you make Professor Bankole the co-host? Yeah, thank you very much. Yeah, sorry for the delay, sir.
All right. Good afternoon, everyone. I hope you can hear me. Before I start my presentation, on the chat box, I think there are two questions there for the earlier speaker, Dr. Esene. So maybe he can take them while I start to share my screen, if that's, or except you want to
I'll just read them out. Good afternoon, sir. Thank you for your talk. Please, can you expatiate further on the opportunities in neuroscience aside surgery? And the second one, can you be undergoing residency and be a global neurosurgeon?
Okay, all right. Okay, thank you. Hey, welcome, Femi. So with respect to the first question, talking about opportunities in the neuroscience in general, you know, the neurosciences is very broad. Okay, you can move from the basic neurosciences to the clinical neurosciences, and then you have neurosurgery, neurology, and then neuropsychiatry. So as I told you before, I mean, my focus in past years have been in neurosurgery. So, but if you want to get much information about neurology, about neuropsychiatry, For neurology, there's a website that I mentioned to you, the website of the World Federation of Neurology. If you get there, you're going to see their programs, the different programs that they're offering in neurology. I think in Africa for neurosciences, there's a very important program which is offering a lot of opportunities, global neurosciences. It's called, I think, IBRU. So a lot of people are applying to that. They go from research through education and clinical care. So I think if you go to the IBRU website, I think it's IPRO, yeah, the IBRU website, you're going to find a lot of opportunities there for the neurosciences. And then for neuropsychiatry, also you go to the World Federation of Neuropsychiatry, the website, you're going to see all these opportunities there. Yeah, you can start.
Amani, stop eating your shirts. Come here.
Smile, yeah, I can't get you. So for the second question, yeah, during a residency in North America, it's possible. Most of the trainees there, because they have a year which they undergo, they do a year which is consecrated for research. So during the research year, you can actually take maybe a course in global surgery, global health, global neurosurgery, and so on and so forth. So it's possible, but with most of our training programs back here in the continent, which are mostly around 5 years, so they focus mostly on the clinical part. But if you're actually interested, then after your clinical training, or as a surgeon, you can then go in to take a course to become a global health expert.
Okay, can I continue now?
Yes, Femi.
Yes,
Yeah.
All right. Okay, great. So thank you very much for the opportunity to speak at this webinar. So my talk is quite short. My plan is not to go into exhaustive detail, but just to give a bit of an overview and hopefully stimulate interest. And then if there are questions, which I hope there will be, many times you can learn more from questions than just talking offhand. So has been stated, thank you for the lovely introduction. I do work at the College of Medicine, University of Lagos, and also at the Lagos University Hospital. So I don't have any disclosures, at least not that are relevant to this presentation. But I want to first of all start by thanking the Nigerian chapter of the Mission Brain Foundation for this invitation. I took some time to read up about the Mission Brain Foundation, and I'm really excited with the work that they are doing in mostly in probably what you call Latin America, but it's good work, and by extension, the work of education that's also being done in this part of the world. My medical background has already been said. I will refer a little bit to this just in the course of my presentation, but I am a graduate from the Obafemi Awolowo University. I'm one of those people that entered in one university and finished in the other university. In the sense, I entered the University of Ife and then I graduated from the Obafemi Awolowo University as the cases, and then did my residency in neurosurgery in Louth, and currently work both in Louth and at the College of Medicine, University of Lagos. It's a faculty. The topic is navigating medical school and residency. I modified it a bit with emphasis to Nigeria, because that's where I have spent the vast majority, if not all, of my own medical career. And that's where I can probably speak with some degree of confidence and expertise. The training here is similar to, but differs at some important points in other parts, from other parts of the world. So and I know that most of the audience are people who are also training either in Nigeria or at least in or around that country. But if you are interested in information from other clients, like Western or even Eastern Europe and stuff, then this presentation may not necessarily apply. And also I realized that many of the people on the audience, or at least I think they are people who are already in medical education, at least undergraduate level, and are probably more in their clinical years. So I'll try not to belabor that point too much. But to say that the undergraduate medical education in Nigeria, the curriculum, like I said, is unique to Nigeria. And largely the input is from two main bodies, the Medical and Dental Council of Nigeria and also the Nigerian Universities Commission. Sometimes there's a bit of a talk between who is doing what, but the council basically sets the regulations in terms of requirements for rotations, both at and the duration of the training that is set by council. NUC comes in to try and structure it within the existing university system, and sometimes that can be a bit challenging or conflicting. So, for example, more recently, NUC is trying to move everything into what we call the course unit system. And traditionally, medical education has not been based on a course unit system. So that is being worked out, but those are just details that need to be worked on. So in the Nigerian system, the medical education undergraduate is a 6-year program. The first year is usually on core science, basic science, and then the next 5 years are focused on core medical education, basic medical science for 2 years thereabout, and then clinical aspects for the last 3 years. In some universities, Lagos being one of them, there's an option of having an additional degree during the course of the training, but that means spending an extra year after basic medical, after second MD, to pursue maybe a degree in the anatomy, physiology, biochemistry, or as the case may be. The conversation has been held in times past about maybe whether to make medical education a second degree kind of thing, like as exists in the United States, for example, or to leave it as it is as a first degree. And I think there are pros and cons, advantages for both arguments, but for now it remains a first degree, and I think we will probably keep it like that for a while. Getting into medical school is quite challenging in Nigeria, as it is in many parts of the world. In every part of the world, getting into the program can be quite challenging. But and staying in the program is also quite challenging. I think back to when I was in medical school, and it was almost a challenge anyway, in terms of the requirements and the rigors were quite high, and which in those days was quite notorious for trying to weed out very aggressively people who it felt were not suited for the program. But the good news is that some of us survived, and as you all are, and it can be rewarding, and it is rewarding as you continue within it. Navigating through medical school sometimes looks a bit like this. I have a personal experience now that someone very close to me has entered medical school, and there seem to be so many things to know, to learn, to understand, to come to grasp with. And so if you're not careful, it can look a bit of a maze. But what I tell people is, you have to take it one at a time. Beginning with the end in mind is a phrase that was popularized by a man called Stephen Covey, who's dead now. In his book, The 7 Habits of Highly Effective People, he talks about beginning with the end in mind, one of the habits, and that is to try and visualize what your stated objective is, and then walk backwards from there. So rather than being overwhelmed by all the requirements or the great burden of knowledge that is required to pass or graduate from medical school, or even the requirements, like, for example, I remember when I was in my first year, And then we were told that if you failed any course, you had to repeat the whole year. And that was a situation at that time, at least in the first year. If you failed the course, you ended up repeating the whole year. Instead of focusing on that, just focus on the fact that, look, this is what I want to do, and then take it step by step and walk your way backwards from there. So beginning with the end in mind helps you to, hopefully not focus on the catastrophic possibilities of failing or not passing out or being expelled or things like that, or being asked to change your course and stuff. And so you must believe in yourself. At this stage, you are people who have survived many different rigorous examination settings. If you're in Nigeria, you survived YX, survived JAM, probably your university had some exams that you had to go through as well. So you've done quite a bit already. You are like we used to call ourselves in those days. You are all local champions in your own right. And so you have to believe in yourself, believe that since other people have done it, you also can do it. So you must have a yes, I can mentality and believe in yourself. And the beautiful thing of now, today's world is that networking is very high is very available. So you must link up with like-minded people. For example, the people in this foundation, Mission Brain, and other similar foundations across whichever medical school that you're in. So one of the things I also do, in College of Medicine, we have a student-led surgical interest group, Surgical, that come on board in the last few years and are quite active. And so you can link up even in medical school with people who are interested in surgery, maybe even not neurosurgery necessarily, but just interested in surgery, and connect at that level. And that kind of support group and support systems will definitely help in helping you to navigate through the school with little difficulty. So linking up with fellow students, and then also look for and take advantage of within faculty, whether they be juniors or senior faculty. So by junior faculty, I mean residents or senior residents or junior residents who are ahead of you in the program, can also be very helpful in helping to navigate the process, and also in learning and in other areas. And also your consultants and faculty, there will always be those that are waiting. So, rather than again focusing on those that, oh, I can't go and meet this person, I can't go and meet this person, look at the person you can go and meet, and then meet them. In fact, and it is part of the Hippocratic Oath, which is that as physicians, we are obliged, and most of us are actually happy to mentor and help colleagues that are coming behind. So take advantage of within faculty, ask questions, seek advice, seek counsel, and before you know it, the 6 years will be over and you'll be on the other side of the bridge. And also to say that consistent hard work really is the key. So again, we find out very quickly that because the volume of knowledge is so high, trying to do a rush job or crash course does not always end up well. So it's important to be consistent in terms of hitting the books, going to clinics, attending lectures, just being around. You'll be surprised how much knowledge you can get just by being around when conversations are being held, clinical conversations, doing clinical meetings, and paying attention to your books, even if it's a few hours every day. You find that that kind of consistency in your reading pays off great dividends at the end of the day. So moving on, now you are a doctor. What next? Well, again, in Nigeria, the steps are fairly, I think the first 2 steps are fairly structured. So obviously internship, house job, first 12 months, and then youth service. and then residency. What I would advise the audience, medical students, especially if you're interested in neurosurgery, is you can actually begin to prepare for some of these steps ahead. So house job is a very good time to, get a sense of where your interest lies, and if you really are interested in surgery, and if you are willing to stand up to the rigors of it. And then youth service. I remember that by the end of my house job, I had always had an interest in surgery as a medical student, and I thought I wanted to do neurosurgery, but I didn't have much exposure in that direction. And during my house job, I got very good exposure in medicine, cardiology, very good exposure in obstetrics, and just basic exposure in surgery. So at the end, I was almost a bit put off to do something else. But again, the role of having more senior colleagues that one can talk to and bounce ideas off help to redirect my focus. And during youth service, the opportunity is there. You can actually begin to plan for the next step, which is residency. Many people allow time to lapse.
I'm sorry, Prof. Bankole, your slides aren't changing.
Oh, wow. Interesting. What slide are you on then?
I think I'm still on the first. Dr. Ese put it on the chat.
Yeah, you are still on the first slide.
Oh, okay. I think that's something that happened in the last two lectures I've given. For some reason, when I go on slideshow,
Is it possible maybe to make it in PowerPoint?
Pardon?
Make it bigger. Please make it bigger in PowerPoint. Yeah.
Yeah, it moved to PowerPoint. Okay, can you see my slide now?
Yes.
Yes, we can.
Yeah, we can see.
You can go to slideshow.
It was on slideshow all this while. It just wasn't moving. I could see it moving, but it wasn't moving on your end. Don't worry, I'll just continue like this. Okay. So you can see the slide with the background.
Sure.
Okay, and then this was what I was talking about, undergraduate medical education. Okay, I'll make this a bit bigger. All right, and then I have this slide. Okay, and then okay, so this is the slide that I'm on now. Now you're a doctor. Can you see that?
Yes, sir, we can.
Okay, so I was just talking about the fact that you try and limit the time gaps between each phase. So between youth service and residency, many people have significant gaps between that time, and that also eats up into one's life. So if you already have an idea of what you want to do, in this case, the focus is on neurosurgery, then you can actually start preparing for the first stage, because under the colleges, you need to do a primaries. In the days past, you need the primaries to start residency in many of the bigger hospitals. Nowadays, it's not so much so, but whether you've had it before you start or you do your primaries after you start, you still need to do the primaries. And so you can use youth service here to prepare, which is what I did basically when I went to serve. I just took my books along and used the 1 year to read up on anatomy, physiology, biochemistry, and the various aspects that the primaries will test, so that by the time you finish your youth service, you actually start for the primaries, and you are ready to enter a residency program. So residency program. So this is a quote. I was going to ask, if anybody knew where the quote was from, but put the answers there myself. So if you read A Tale of Two Cities by William Shakespeare, the opening line, I believe, goes, it was the best of times, it was the worst of times. So in the Nigerian space now, as far as postgraduate medical education is concerned, there are aspects of it that it's the best of times, and the aspect of it in which is the worst of times. That I'll try and elaborate on that. For neurosurgery, for example, It's the best of times because we have, for at the moment, over at least 13, but over 13 either fully or partially accredited training centers for neurosurgery. That has never been the case. So we have the most number of centers for neurosurgery now than at any point in time in the existence of our nation. When I was training, we had basically 2 centers, Ibadan and Lagos. And although Lagos was a center, it hadn't really trained anybody. And I ended up being the first person that got fully trained in Lagos. So in that sense, it's the best of times because you actually have a lot more training opportunities, a lot more training centers, and a lot more trained neurosurgeons in terms of interaction, in terms of cases that are being done. It's a really good time for neurosurgery training. It's the worst of times because of the challenging socioeconomic situation that we find ourselves as a country, which is not obviously peculiar to neurosurgery. So in that sense, there's a lot of push or pull factors that are making a lot of our young ones, including, I'm sure many of you listening to me, consider moving out of the country completely or doing the residency in other things that may not be as demanding of their time and of their of their life, But again, there are opportunities to be had, and we can take care of that. Take advantage of such opportunities. It's also again a very good time because the program now is more structured and it's becoming increasingly more structured. I know that because currently the West African colleges undergoing a curriculum review, trying to also further structure not just the course of the training, but also even the content of the training. Like I alluded to, when I was training, I was the first person to be fully trained in my center. And so there was not real structure in place. And you sort of, just went along and learned as you went along. But now it's a lot more structured, and we have a system which we are producing residents and getting a sense of what we're doing. The other thing is that the pass rates are higher now. So again, best of times, this is a very good time to be a resident because the pass rates are higher now, both at all levels, if I'm not mistaken. The Part 2 pass rates for neurosurgery are consistently above 50%, which is very high. In times past, Part 2 pass rates were significantly less than that, both not just in neurosurgery, but in other aspects. Having said that, it's still a very rigorous and demanding specialty, and the training is still very demanding and rigorous. So it's a bit easier to go through, but it's still very rigorous. Also, the paucity of the number of people coming for residency is both a blessing and a challenge because there are fewer people, then the chances are if you are interested, you'll get taken. In fact, if somebody's interested in coming to be a resident, maybe in any teaching hospital now, the chances are high that you'll get taken. The last time we had exams, typically you will have the hall very full and you have to be doing interviews all day trying to screen out those you felt were less than optimal. But now, the candidates are so few that just like, you know what, all of you just come, we'll start with you and we'll find out how well you're doing as you go along. So again, like I said, there are opportunities to be taken advantage of. So there are 2 colleges that offer training in neurosurgery if you are practicing in Nigeria, the West African College of Surgeons and the National Postgraduate Medical College. They both offer training in neurosurgery. That has not always been the case. In times past, it was only the West African College that was offering training, but that has changed in the last decade or more. The training is for a minimum of 7 years. Minimum of 7 years there. It's broken into 2 main parts. I had mentioned the primaries. The primaries is regarded as an entry level exam. So until you've passed the primaries, your training may not effectively have taken off, according to the colleges. And then after that, there's supposed to be a 3-year period of rotating through various surgical specialties, trauma, orthopedics, etc., general surgery, urology, plastic surgery, for a period of 2.5 to 3 years, and then to write the exam. So the first part one comes up 2.5 to 3 years after the commencement of the residency. And then after that, then the part 2, which is the core training in neurosurgery, is for a minimum of 4 years before one can qualify to write the exam. So that's why I said minimum of 7 years, plus or minus. The truth is that most people end up taking a little bit more time because the rotations are not always perfectly thin, and then one may not qualify immediately for the exam. So for part 2, part of the requirements, apart from the clinical rotations, include writing a dissertation on a topic that has been approved by the college. So that sometimes also delays people. I had mentioned that the curriculum is being revised to align with international standards in both its content and in the spread of cases. Again, Dr. Sene has mentioned this a little bit, talking about collaborative research and exposure that is more available now than it was in times past. So in some centers, including ours, we have opportunities for some of the residents to even spend time outside the country for both clinical and research experience. So that's available in some places as well. And opportunities for research, both at undergraduate and postgraduate levels, are also available. And I would like to encourage the members of Mission Brain, if you're not already doing that, you should start trying to collaborate with your faculty in the neurosciences, in your hospital, to even at undergraduate level, to present. We have scientific meetings every year. At the last one, there was a quiz competition for medical students. Let me see, I'm not sure if somebody, I think that was one of the finalists came from UNILORIN, if I'm not mistaken. So that opportunity is there to participate in such presentations, do a research, present in conferences. These things, when you add them to your CV or your application when you're coming for residency, it does make a difference because it shows someone who is already quite committed to the cause, and that's one of the things that we look for. Just to mention that gender is not a barrier. We've been able to train 5 female neurosurgeons so far, and hoping to train more. There are others, I know 6 actually, somebody passed in the last exam. So more people are being trained. So gender is not a barrier, and I hope that some of our female students who are listening take that as a cue. Okay. One of the requirements, again, like I said, I'm just trying to give some broad strokes as far as navigating through the whole process is concerned. For residency, generally, we have what we call technical and non-technical skills that are required. Obviously, technical skills or what we call academic skills. So for neurosurgery, a very strong base and knowledge in neuroanatomy and neurophysiology is required. But with non-technical skills, many times make the difference between the person who is successful relatively easily and the person who is not. So having a very high intelligent quotient, obviously, like I said, we're all local champions. But there's also the aspect of being emotionally sensitive or emotionally aware of one's environment to be able to perform well as a team player. So one of the things I look for in residence is not just a high IQ, but also a high EQ. So you want to be a good team player, someone who works well with others. Gone are the days when the surgeon is a strong, silent type and doesn't communicate well with other people. You want to be able to communicate well across your team and even with people that are in other allied fields. You want to be proactive, so taking the initiative, looking for things that will make a difference and will help to improve existing practice, even in your local environment, is something that would stand you in good stead. And also having very strong or well-developed leadership skills will also help and stand in good stead. So this is a very short list, but definitely something that would help for someone who's trying to pursue a career in neurosurgery. So in conclusion, I would say that neurosurgery as a specialty is challenging, but very rewarding. The training in the country is available, and increasingly so we have, like I said, the largest number of centers being accredited to train, and more so more are coming up on board too as well. Where you then choose to be trained will be up to available spaces, opportunities that one meets, and sometimes also who you taking on board as your mentor and whose career you choose to follow. But there are options out there, so you want to explore them, find out from people who are already in the training program what their experience is and how such training will gel with your own career path and career plan. It may seem like a journey of 1,000 miles, but it starts with one step, like I'm told the Chinese proverb tells us. So my encouragement to you and to all of us listening is to take the next step. With that, I end thanking you for the opportunity. And if there are any questions, I'll be happy to take.
Thank you very much, Professor Bonkali, for your nice talk. It was insightful. I don't know if we have a question we can take it before to move to the next speaker. And sincerely, we really value your time, Professor Bonkali, Dr. Ignatius Essene. Thank you very much to take your time to join us and to present your lecture.
Thank you. You're welcome. It's a pleasure.
Thank you.
And please, if you have questions, let's kindly drop it on the chat so that I'm going to read it and Prof answers. Thank you.
Perfect. Perfect. Please, Mubarak, could you introduce the next doctor which will present for the next speaker, which will present the next speaker, please?
Yes. 1 minute, please.
Okay. I think you sent me, it should be Dr. Mustafa Fati. I don't know if it is here because we will gonna have the lecture from Professor Wahab. I don't, do you confirm that Professor Wahab is already with us? Hi, Professor Wahab, are you there? I don't see him on the chat. Okay. Okay. Mubarak, do you have any news from Professor Wahab? Maybe if he's not joined us yet, do we have Professor Daniel Popola? Dr. Daniel Popola is there. Yeah, I see Dr. Daniel Popola. Welcome, Professor Daniel Popola. Professor Wahab, I don't see him yet. Okay. Maybe to don't waste the time, if Professor Popola is ready, we can go with Professor Popola and then Professor Wahab will.
I'm so sorry. I was trying to reach out to Professor Wahab. I just spoke to him. So there was an issue with the time zone. So he thought it was 5:20, but he'll be joining us in a few minutes.
Okay, so
I think before then,
yeah,
those that have questions, kindly. Okay, he said he has another engagement. I mean, Professor Bankole.
okay.
So unfortunately, I don't think he'll be able to answer questions. You mentioned it before.
Maybe we will see if the question is but we
If there
can
are any
ask.
questions now, I can take them, but
Okay. Thank you very much, Professor Bankole.
By
We appreciate you. So please kindly drop your questions in the chat box so that we can answer.
Okay, Dr. Fati is already there, is ready.
Yes, he is. But I felt Professor Wahab should join us before his citation is read.
Okay, perfect. So let me know when he joined.
Yeah, he's going to join us soon. Please, let's drop our questions.
Yeah, so, and also I think Dr. Daniel also Popov say he need a little bit minute to set. Okay, so I hope that all of you are enjoying the session. Don't hesitate to put your question on the chat. And thanks again to stay with us.
Okay, I think there's a new message or something. Yeah. Daniel is saying it was an incredible and an insightful talk by Prof. Bankole. Thank you very much, Prof. Bankole. Yeah, I guess I'll just drop my question. Let me.
Okay, so there's a question on why are there few female neurosurgeons in Nigeria? Well, so why are there few? Well, I think generally, if you look into the surgical field in Nigeria, you find that there are few females in surgery generally, and by extension, in neurosurgery. Again, the total number of neurosurgeons in the country is actually much fewer than most specialties, maybe apart from cardiothoracic. So while the representation may seem to be relatively small in number, but it's something that it's a function of both access. I talked about the fact that there are very few training opportunities in times past. So what we've seen is that as the training centers have increased in numbers, I mean, the 6 that we've been able to produce have been produced in the last maybe 7, definitely in the last 10 years, really. So we hopefully, I mean, where I train, which is Lagos, we still don't yet have, we haven't been able to train anybody in neurosurgery. So, all I would say, our gates are open. So if anybody's interested, they should please come aboard.
Then there's another question here. What are the solutions to the difficulty in assessing neurosurgery faculties due to their busy schedules? Perhaps if you're an aspiring neurosurgeon and you just need someone to ask some questions, get access to opportunities. So how is the best way to go about that?
Okay, well, so I mean, there's well, one will leverage on technology. If it's in the center where you are, for example, then there's always downtime. I think it's a function of trying to have that conversation with the person and say, when would be a good time for them to fit in, maybe after clinic or before a round or after a round. It's for them to fit you into their schedule. And the same thing, even if it's someone who is not in your center, then it's a function of trying to leverage on technology, maybe schedule a WhatsApp call or even a Zoom meeting. Again, obviously, because of schedules or busy schedules, then it may not be something that happens every week, for example, but I'm sure people can commit to once a month or once in 2 months, as the case may be, and they will make themselves available.
Thank you very much, Sarah. I think I have an additional point on chatbot by Dr. Popola. He said there's also an organization called Women in Neurosurgery that provides international mentoring and networking opportunities for women interested in neurosurgery. So you might want to check it out.
Yeah, that's correct. And the Nigerian Academy of Neurological Surgeons also has Women in Neurosurgery chapter. So if there's someone who's interested, you can get in touch with me and I will try and link you up with them.
Yeah.
Wow, that's great.
Yeah.
Sarah, thank you very much.
Yeah, just to add to what Femi said about women, women, they make up of a very small proportion of neurosurgeons worldwide. So there's been that advocacy to support women into neurosurgery. So at the level of the world stage, there is the wings, which is Women in Neurosurgery of the WFNS. In CANS, unfortunately, CANS has not been able to create CANS, which is the Continental Association of African Neurosurgical Society, have not been able to put in place a committee for women. But I think this is going to be done very soon because, I mean, it doesn't look presentable, whereas at the moment, many women are encouraged into the sciences, and then at the level of the continent, we're not creating opportunities for them. So any lady who is interested, I mean, there are many opportunities for women at the present time.
Wow, thank you very much for that insightful contribution, Dr. Essen. If you have questions, let's drop it. I think how we'll be doing it soon. Okay, I think I have one here. Thank you. What characteristics does a candidate for neurosurgery have that would be disadvantageous to getting a residency position? Sorry, Prof. Bankole, are you there?
Yes, I am. So what characteristics will be disadvantageous? Well, I can think of a long list, but I think realistically, I mean, obviously, as human beings, we're all different. So, but I think if someone is prone to, so you have to be a good surgeon generally, and obviously a good neurosurgeon by extension, you should be able to control emotional outbursts, let's put it that way. And you need to be able to communicate in a manner that is non-hostile and threatening to other people. So those come probably top on the list of things that will be easily seen and would make someone feel, oh, this person may not be a good fit for a residency position generally, not talk of neurosurgery. Obviously, knowledge, like I said, there are technical and there are non-technical skills. Technical skills, like hand-eye coordination, being good with your hands. Most people, if they weren't good with their hands or had difficult hand-eye coordinating, they would probably have discovered that at the undergraduate level and moved to a non-surgical specialty, or if they can't stand the sight of blood or stuff like that, they probably have moved to a non-surgical specialty anyway. But of course, if such people still come in, then they may have to be told that, you know what, this is not working. So usually, I mean, the course of training, obviously there are different situations and scenarios that will come up that will highlight different characteristics. It's only when they show up that you'll be able to take them on board. But The first two I mentioned, I think, are things that if someone is considering any training program, anywhere, you want to make sure that you have a handle on that. If your communication skills are poor, and if your emotional control is poor, then you will struggle.
Thank you very much for that.
I hope that
answers contribution. I have another question here. In your opinion, what would be an excellent resume? I mean, what should be on the resume of someone interested in applying for residency? Can you give some advice on this?
Okay, fine. So yeah, again, I sort of try to mention a few things, like during the course of your medical school or even house job, if you've shown interest in different surgical related things, maybe you're able to collaborate in some research, or you have been part of a group that has done something, those are good things to add in your resume. If you've been involved in some mission camp or something, outreach program, those are also all good things. You've been able to collaborate to, write a paper, even if you're the 120th author, there, it makes no difference. The fact that you've been part of the process are all good, especially because nowadays research is becoming an increasingly important part of the residency program, especially at the part 2 level. So those are all good things to add into one's resume. Again, coming into residency at least in Nigeria is pretty straightforward. I mean, if it's outside the country, I mean, you will be competing with people that have PhDs and masters and stuff like that. But here, that's not always the case. Of course, if you have a PhD or a master's, that's also good, but it's not something that we typically will look for. So I think just basic things, having, being on the merit list, gotten some academic awards here or there, and then some engagement with the profession. Some at the last General Meet Scientific Conference of the Nigerian Academy, we had some medical students come to present. One of them got an award for best presentation. If you add that in your CV, it would help. Even if you didn't get the award for the best presentation, the fact that you won't presented at all will definitely also stand in good stead. So I think those are just some things that you can add beyond where you were born.
You motherfucking nigger, I'll go fuck your mom with the lights, you motherfucker, black woman, black bitch, motherfucker.
Sorry,
you
Timothy, can you repeat that person?
bitch.
Thank you. I think I have a question here. Is passion enough to see one through residency training in neurosurgery in Nigeria?
Is passion enough
to see one through residency training in neurosurgery?
I think short answer probably will be no. I mean, in the sense that passion meaning that I want to do it. Wanting to do it is not enough. It's a good place to start, but obviously being able to do it will definitely make the difference. So wanting to do something and being able to do something are not always the same thing. But if you want to do it and you're able to do it, or at least you're committed to the process of learning to how to do it, then I think one would sail through eventually. So is passion enough? I would say no. Passion plus ability would be a better mix.
Okay, thank you very much. The last question, because I think our next speaker is here, is what do you think is the solution to poor dissemination of information about these opportunities for students and residents? Like you mentioned, there was an abstract presentation at the NANS AGM conference, and some people didn't see the updates like me.
Well, okay. Well, I think part of that probably lies on us. That's those of us organizing such meetings. to put the announcements out early enough so that it can get circulated. Sometimes you put an announcement, but it takes some time for people to get traction on it. So for that, we apologize. I think as far as solution is concerned, well, it's try and bring out the flyers or the information earlier enough. And also, if you have bodies like this, they can also from time to time network with the various the Academy of Neurological Surgeons or NSNS and other similar organizations to see what are the roles for their student opportunities in such meetings. I must say sometimes we do make the announcements and residents especially don't always take those opportunities because they feel they're too busy or I'll do it later on in when I have the time and all of those things. But really, there's no time like the present. So it's if an opportunity comes, just grab it, do what it takes, and you'd see how far it goes. All right.
Thank you very much, Professor Bankole. We really appreciate your presence, and we look forward to learning from you some other time.
All right. Thank you. Okay. Have a wonderful presentation.
Yeah. Thank you. Sorry, Timothy, help us be on the watch out. I was just informed that there are some people like hacking or doing some rubbish stuff on the meeting. Thank you. I'm sorry, I think perhaps we would ask him this question and we'll get back to you. Thank you. Dr. Bankole, you can go ahead, please.
So do we have Professor Wahab is ready?
Yes, he's on the meeting. I think his
Okay.
citation is.
Thank you very much. Welcome, Professor Wahab. So please, Dr. Fatih, could you introduce Professor Wahab by giving us a short dissertation regarding the Professor Wahab biography, please? Over to you, Dr. Fatih.
Okay, thank you very much. I am Dr. Mustafa Fatih, an alumnus of the University of Ilorin. Kindly give me the opportunity of introducing Professor Kolawole Wasiu Wahab. Professor Kolawole Wahab is a professor of neurology in the Faculty of Clinical Sciences at the University of Ilorin and practices as a honorary consultant neurologist at the University of Ilorin Teaching Hospital, where he heads the Division of Neurology and the Stroke Unit. He is one of the top 10 most cited scholars at the University of Ilorin and was named one of the top 500 scientists in Nigeria in 2022. Professor Wahab graduated from the University of Ilorin in 1997 and began his postgraduate residency training in internal medicine in the year 2000, culminating in the award of fellowship of the National Postgraduate Medical College of Nigeria in internal medicine, with his subspecialization in neurology in the year 2005. Between 2008 and 2009, he had a master's in public health training at the University of Ilorin before traveling abroad on Commonwealth scholarship to have further postgraduate training at the famous University College London, University College London Institute of Neurology, and the National Hospital for Neurology and Neurosurgery, Queen Square, London, in the United Kingdom. While at the Institute of Neurology in London, he continued his work on stroke and graduated with a Master's of Science degree in Clinical Neurology in the year 2010. He was also a visiting fellow at the Miller School of Medicine, University of Miami, and Jackson Memorial Hospital in Miami, Florida, in the United States of America in the year 2012. Through a scholarship award from the International Brain Research Organization, he was at Montreal Neurological Institute in Montreal, Canada, for a training on neuropathic pain in the year 2013. He bagged the degree of Doctor of Medicine from the National Postgraduate Medical College in the year 2020. The overarching goal of his research is significantly to reduce the high and escalating burden of stroke in Nigeria and other sub-Saharan African countries. To achieve this goal, he collaborates with researchers in and outside Nigeria, and his team has won many international research grants focusing on stroke epidemiology, risk factors, prevention, and outcome. Through a research collaboration with George Institute of Global Health in Australia, he was the African leader in the landmark International Clinical Institute in the trial titled The Third Intensive Care Bundle with Blood Pressure, Reduction in Acute Cerebral Hemorrhage, that is Interact 3. This journal was published in Lancet in May 2023. The novel results from Interact 3 study are being incorporated into the guidelines of management of intracerebral hemorrhage, a devastating type of stroke globally. He is currently the African principal researcher in another clinical trial entitled Triple Therapy Prevention of Recurrent Intracerebral Disease Event Trial, Trident, also in collaboration with George Institute of Global Health in Australia. He is a recipient of many international awards and scholarships, including Islamic Development Bank Undergraduate Scholarship, Commonwealth Scholarship, American Academy of Neurology International Scholarship, World Federation of Neurology Traveling Fellowship, and International Brain Advocacy Leadership Award by the American Academy of Neurology. Among others, in the year 2014, he was selected for the prestigious Pelatucci Advocacy Leadership Award by the American Academy of Neurology, which afforded him a leadership training in California, United States of America, and was the only African out of 30 awardees selected globally for that year. Based on his research output and quantum of research grants, he attracted to the university, and based on the research grants he has attracted to the university, he was also granted the Best Researcher at the University of Ilorin Award in the year 2016 and was presented a Toyota Corolla car. In 2018, he was named as an emerging global leader in stroke research by the World Heart Federation at a ceremony held at Duke's Kunshan University in China. He was also elected the best lecturer by the graduating set of medical students at the University of Ilorin in the years 2011, 2013, 2018, and 2021. Prof. Wahab is a fellow of the American Academy of Neurology and also American Neurological Association. He is the current secretary of the Faculty of Internal Medicine, National Postgraduate Medical College, Nigeria. Some of his leadership responsibilities include being a member in the guideline writing committee of the World Stroke Organization. He was also the immediate past secretary of the Nigerian Hypertension Society. He is also the editor of the Journal of Clinical and Applied Neurosciences. He's also a guest editor in the Journal of American Heart Association. He's also a commissioner representing Nigeria in the World Health Organization, Lancet Neurology Commission on Stroke in Low and Middle Income Countries. He has published more than 180 articles in reputable outlets and has also contributed chapters to 2 medical textbooks. He has made several scientific presentations nationally and internationally. He loves traveling and reading motivational books. Ladies and gentlemen, join me in welcoming a model, a teacher, and a mentor to many, the person of Professor K.W. Wahab. Thank you all so much.
Thank you very much for that. I want to appreciate the organizers for this invitation to come and share with all of us. And like we know, life is an acronym for learning is forever. So I'm glad that I'm here to learn from others too. And I want to appreciate Professor Bankole and Professor Esene and all other resource persons at this conference. It's my pleasure to be here to discuss research opportunities in neuroscience and looking at building your academic career. So I'm very happy that you made a focus early in your career. And it will be as if you've read the book by Stephen Covey. That is the book titled First Things First. Because this group is like a group that is already well focused and you know what you want in life. So in that book, it said that we need to know what is most important to us. And then what gives your life meaning, and what do you want to be and to do in your lifetime. So if you've not read the book, I will recommend that you get a copy and read it. This is not a paid advert. Now, globally, we know that we have a lot of issues with health. And in Africa, we don't just have a share of the burden. We have a huge share of the burden of these health disorders. And neurological disorders are just some of those disorders. So Africa accounts for about 15% of the global population, and yet we account for 25% of the global burden of disease. Now, when you now look at research output globally, we account for just 2% of the research output. And in terms of global investment in R&D, that is research and development, we account for just 1.1%. So if you look at the continent of Africa, despite the fact that we are so endowed, we are so blessed in terms of material and human resources, to look as if we are underperforming. And that is why I'm really glad that we have a group of people who are forward thinking and have decided early in life that they want to become neuroscientists. So who is a neuroscientist? I'm sure other resource persons would have mentioned this, but like you know, the secret of memory, secret of good memory lies in repetition. So you're going to have a lot of overlaps in what I'm going to say with what others have said. So a neuroscientist focuses primarily on the study and research of the nervous system. Now, these studies could range from cellular to systemic level studies like cognitive and behavioral studies, or looking at stroke, which is my own area of passion, and then dementias and Parkinson's disease. So, but when you look at neurosciences generally, what I've given is a broad definition, but we can divide neurosciences into basic neurosciences and clinical neurosciences. And then we have an area of overlap between basic and clinical neurosciences. And that is why we all need to work together and continuously so too, so that we'll be able to achieve our aim. And I believe the aim of you guys coming together and for putting up this conference is for us to work together to reduce the global burden of neurological disorders, and doing that from home, because they say charity will begin from home. So basic neuroscience scientists are there and clinical neuroscientists are there. And why is it important for us to have neuroscience research? Now, we'll know that you will have a bi-directional relationship between clinical practice and research. And that is because we move from the bedside to the research laboratory and back to the bedside. And it is only when we do that that we come up with evidence. And that actually informs what we call evidence-based medicine. So because it's whatever we've gotten from the investigations we've conducted, from our research works, that will subject to evaluation of evidences, and then we'll come up with the best of the evidences and say that will be the best way to approach the management of a particular patient. So because of that bi-directional relationship between clinical practice and research, we need to just keep this going so that we'll continue to improve on what we do. So what are the major branches of neuroscience? We have behavioral neuroscience, cognitive neuroscience, and clinical neuroscience. And there are some others that I'm going to talk about. Now, when you talk about behavioral neuroscience, this is the study of how the brain affects behavior. And then cognitive neurosciences, I will look at how the brain forms and controls thoughts. Now, I'm a clinical neuroscientist, and we know clinical neuroscientists, specialists such as neurologists, neurosurgeons, neurophysiotherapists, and psychiatrists, among others, who look at disorders of the nervous system. And then we have computational neuroscience. These are scientists who try to understand how our brains compute. So they use computers to simulate and model brain function. And we have cultural neuroscience, which is a field that looks at the interaction between cultural factors and looking at it that do we have genomic, neural, and psychological processes affecting how culture evolves. So it's a new discipline. And then developmental neuroscience, which looks at how the brain and the nervous system grow and change. That is from conception through adulthood. And then we have molecular and cellular neuroscience, neuroengineering, neuroimaging, which is a very vital part of clinical neuroscience, and neuroinformatics. So, but I'll go quickly to developing a career in neuroscience. How do you go about this? Because I've talked about the different branches of neuroscience. How do you now go about developing your own career path in neuroscience? Now, we know research is a creative process. So you need curiosity. And it's from your curiosity that you're going to get your research idea from, and then you generate your research question, which is now going to lead you to formulation of your objectives. And we usually talk about SMART objectives. Okay, so these are very, very important ingredients that you need to have. And you need to have a goal. And of course, since you've had your goal, you need to now work towards achieving that particular goal. So you need to have a target. And the question will be, where do I want to be in the next 5 years? And where do I want to be in the next 10 years? What will I want to be known for in the next 10 years, in the next 20 years? And if you have already formulated that, the next will be that you now want to work towards the target that you have set for yourself. And then, of course, you have to pray for achievement of your goals. But importantly, you need to identify a mentor. So identify a mentor and send him a mail. So, and in the mail, you need to introduce yourself and tell him about your background and why you are interested in his research and his mentoring. And this is very important because if you recall what Isaac Newton said if you are seen further than others by standing upon the shoulders of giants. So you need to identify a giant in the field of neuroscience that you want to sit on his shoulders so that it can guide you on how to go about this. And another thing you can do would be to volunteer. Volunteer to come and join a research group, or you've identified a mentor. Volunteer that you want to be his research assistant, or to join his research assistants when they are doing research works. Or you just do a formal or informal application to the person that you want to come and observe or to shadow what he's doing. I recently had someone who came all the way from the US just because he is interested in neuroscience and just about to get to the university. But he wanted to have an idea of how we practice neurology in Nigeria and how we conduct our research. So the guy was there still, he was with us up till yesterday. So you can shadow, you can have observership, even though you've already started your own undergraduate or postgraduate training as may be applicable. Now, one very important thing is that you must be abreast of information. And when you read research works, you need to critically appraise such research works so that you'll be able to identify what gaps there are in knowledge. And it's only when you identify such gaps that you want to say that, okay, you want to formulate a research hypothesis that you want to test in the research. So remember what Muhammad Ali said, that champions aren't made in the gyms. They are made, and they are made from something they have deep inside them. They have a desire, they have a dream, they have a vision. And I can see all of this in all of you who are assembled here today. So my charge will be that you should go forward, try and develop what you have as a vision. Don't let it just be a dream, because dream without action is an illusion. So it's what you desire to be in life. So you need to work towards that. And if you are able to do that, I can assure you that the future looks very bright because the future of neuroscience is really, really very bright. Thank you very much for your attention. Over.
Thank you very much, Professor Wahab, for very concise and insightful session. We really appreciate. Okay, I think for so fast, we have questions coming in. Please, let's bring them in. I think we have more time. The first question is, when is the best time to reach out to mentors for observership or volunteering, undergraduate years or afterwards?
Okay, you want me to be answering them as you are reading?
Sir, if that works.
Oh, okay, so fine. All right, so the best time will be, it will be a very difficult thing to decide. But if you are an undergraduate and you are interested in neuroscience, I think the best time will be that time you made that decision that you are interested in neuroscience. So reach out to a potential mentor. Now, if you are having that, you have that interest and you don't get in touch with a mentor at that stage, what you could have gotten in terms of developing yourself, you're going to miss them, because if you wait till when you want to do your postgraduate trainings, there are some institutions that want to see what you have done in terms of publication, in terms of volunteering during your undergraduate years. So if you wait till you get to your postgraduate or you are starting your postgraduate studies, you would have missed such opportunities. But if you are a postgraduate student, again, the best time to do that is now. And you work on the saying that if you wanted to use an Iroko tree to make your table, for instance, the best time to have maybe planted that tree was 10 years ago. But if you miss that opportunity, then the next best time is now. I think that answers the question.
Yes, thank you very much for your insightful answer, Professor. I think we have another question here. Why is research poor among Nigerian students, and we have students from overseas coming to Nigeria to work with our senior faculties? What is the problem?
Why is research poor?
Yes.
In Nigeria?
Yeah, among students specifically.
Okay, among students in Nigeria. Okay. Okay. Sorry?
Sorry, I think it's the background noise. I'll just mute it.
Okay.
Yeah.
All right, so what the research could be poor among Nigerian students because of several factors. It could be because of the environment. It could be because of the individuals. And when I talk about individuals, that will involve the students and then will involve the potential mentors. Okay, so if it is the environment, you look at what resources you have, okay, in terms of research. But despite the limitations we have as a nation, despite the limitation of resources, a lot of research works are still being done. And for individuals now, talking about students, it depends on what information you have and then what interest you have. So if you have interest and you don't have the right information, it will look as if nothing is being done. And that's why I said you need to be abreast of information, but not just being abreast of the information. You need to be curious, and then you need to reach out to potential mentors so that they can guide you on what to do. And that takes me to the next one, the mentors. Now, it could be that the mentors are not there, which may be partly true. But the question is, have we really made attempts to reach out to such mentors? And how many attempts have we made to reach out to such mentors? So if we look at this, the three factors I've talked about, we could dilate on them to bring out the reasons why research culture may be poor among undergraduates and even postgraduate students. But it's not really that alone. I've talked about the environment. The environment in the Western world is quite different from here. Like the person I said has come to shadow what we are doing. Is just about to graduate from the college and is interested in neuroscience. Okay, so what they encourage is that at that level, you get someone who is doing this, and then you contact the person, you go and see what he's doing, and possibly see if you can conduct a research before you even start your training. But that is not the same here. And to tell you that things are not as bad as we think, this person came all the way from the US just because they got my name from the internet because they thought that, okay, if this person comes, he will be able to stay with someone in Ilorin and then will be able to now come to see me. So multifactorial thing, like I've said, but I hope I've been able to touch on some of them. The list is endless though. Thank you.
Yeah, thank you very much for that, Prof. Wahab. We have tons of questions here, but then I just want to make mention of the fact that Dr. Ignatius SN, our previous speaker, dropped a research paper on the early introduction of African students to research. So I would encourage everyone to go through the paper. Thank you very much, Dr. SN. I think the next question, I hope I'm not missing anything. Okay, is there any ongoing research in stem cell research and neural regeneration in Africa?
Right, so thank you very much for that question. It will be difficult for me to answer for the whole of Africa because that is going to be a research question for me too. And whoever has asked the question, I think you can generate a research question from that. Neural regeneration, and then look at what are the publications from Africa on that particular subject, and then maybe get it published. Now, there are centers that are having stem cell research centers, but you now need to go and look at what they do there. Even though we know that the future of treatment of some of the neurodegenerative disorders will be in stem cell research. but I can't say that a lot is currently ongoing in Nigeria and maybe in other parts of Africa. I could be wrong. And that is why I said that could be a research question. And what I've said is my opinion. And you know the usual saying that without data, you are just another person with an opinion. So I've just given my opinion. But for us to have hardcore data on this, we'll need to review the literature.
Yeah, I just want to make a comment, Professor Wahab. Thank you so much for your excellent presentation and for the comments you've made. I mean, when I saw your name in the program, I went to PubMed and tried to look at your field of area of expertise. I was really very impressed. Could you please just share your email to us? So that, we can maybe get connected to you maybe for future collaborative projects. Thank you.
That's all right.
Yeah.
Thank you very much for that, Dr. Ethan. All right, I think the next question we have here is, what is the title of the book you mentioned, Prof? You mentioned the book we are supposed to read.
Right, so the book is titled First Thing First.
Okay.
That is it. Yeah. It's written by Stephen Covey.
Okay.
Yeah.
Thank you very much. First thing first. I will make sure I get the book. Then the next question is, as a mentor, what most skills or background do you find most important?
What? I didn't get that.
What's the skill you find most important? I think for aspiring researchers, something like that.
Okay, skills.
Yeah.
That I find most important.
Yes.
Well, even if the person has no skill, when you talk about mentoring, it's about guiding the person. And for the person to have come to me is because he believes that he needs to learn something. And just yesterday, I was discussing with our 400 level students in the clinic. That usually when I have a lecture with our 400 level students, I usually tell them about ascending the ladder from being unconsciously incompetent to be consciously competent. Okay, so as you are ascending the ladder, you are starting from the level of a novice who is unconsciously incompetent. So if someone comes and has no skills, it's because he has identified the fact that he is unconsciously incompetent. That is why he has come. Or that, he has already done some things and he has ascended the ladder a little more, and now he is consciously incompetent. All I have to do will be to guide him. So even if the person does not have any skill, I'll still be ready to guide the person. But it now depends on whether his own research aspirations align with mine or not. And even if they don't align, I'll still have to guide him to get another person to mentor him. I hope that answers the question. Thank you.
Yes, thank you very much, Professor. The next question is, how do we know best researchers to work with? Can you expatiate on that, please?
How do you know best researchers to work with? Now, again, I'm going to talk about you identifying what you want in life, and then what will be your passion. And once you've identified this, you have some keywords. And with your keywords, you can go online and search. Okay, so go on PubMed and search using your keywords. And if you want a mentor from your institution, you can key in the name of your institution and see how many names will come up. I think that would be the easiest way to identify a mentor. And you'll see in your various universities, that there are people who are working, you want to learn about their current research by just trying to be nosy, moving close to them to know what they are working on currently and see if you can tag along. But like I said, it would be nice if you identify what you are interested in, and then get the keywords from such such areas of interest, and then go online, go on PubMed, go on Google Scholar, and then punch in these keywords and then see what returns you're going to have. And we're going to have a short list from that. And with that, you can start to contact the potential mentors. All right, thank you. Over. Am I still audible?
Yes, I can hear you, sir.
Yes, sir, you are very, sir.
Yes, I'm sorry. I didn't know I was muted. I was reading the next question. I'm really sorry about that.
Okay.
So the next question is, how can faculties encourage students to perform research? And what about students interested in wet lab research experience?
Okay, how can faculties encourage students to do research? That's the first question.
Yes.
Okay, so it's all right. So by doing some of the things we are doing now, and then during, here at the University of Ilorin in 400 level, you have introduction to clinical research, which is taking as a lecture. I usually take that lecture. And you have introduction to clinical research through your mini research project. These have been designed to introduce you to how to conduct research. But you need to take that further. Since you are really passionate about research, you need to take that further, maybe by interacting with your supervisor, or if you think that, oh, your supervisor's areas of interest do not align with yours, get another person and then start your interaction with the person. I think with that, you can have your early introduction to research. You get engaged, see how things are done, and you'll be giving assignments, you'll be giving tasks. And once you are able to accomplish such tasks, I think you'll just be part of the team, and then things will start to roll in. All right, over.
Thank you very much for that insightful answer, Professor. I guess I read the remaining questions together.
Sure, please.
If that will.
But I don't trust my memory.
Okay, perhaps I can just take it maybe to or something like that.
Yeah.
Okay, so the next question is, thank you very much for this wonderful presentation. It has ignited a burning sensation and a strong desire for neuroscience in me. I have always developed interest in neuroscience during my first degree as a student of microbiology. Now, I really want to put my all this. And the second question is, thank you for your presentation, sir.
Hello?
Sorry, I'm trying to see if I didn't speak. Okay, I've seen it. You mentioned that neurosurgeon is obviously a clinical neuroscientist. Is it interesting to pursue first a master degree, both in neuroscience and then in neurosurgery?
Oh, that would be fantastic if you are able to do that. Okay, to do basic neuroscience first, and then you now say you want to do neurosurgery. In actual fact, if you are able to do neuroanatomy, that is if you are interested in neurosurgery, if you are able to do neuroanatomy first, before you go into neurosurgery, I think it's going to make life very easy for you. And you'll be able to design more, or you'll be able to come up with more research questions than if you had not gone through that route. But the fact that you have done that does not really mean that your productivity will be better than the person who has chosen not to go through the same route as you. So again, it depends on you. So if you want to do basic neuroscience before your clinical neuroscience, that is fine. But remember that even as a clinical neuroscientist, you still do some basic stuff too. It's only that even when you become a clinical neuroscientist, the fact that you are one does not mean that, oh, you had a background in basic neurosciences, you are now going to be doing everything there. It only gives you a broad idea because you now need to task shift. You'll be involved in so many other things as a clinician that even though you had the skills to do some basic things, you may want to give those ones to others who are members of your team to do. And remember, we're working as a team. Together, each achieves more. So if you do that, you'll be able to free yourself, some time for yourself. And then you'll be able to develop the skills in others too. And at the end of the day, it's about what the team has achieved. I was telling, yesterday we had end of the year get together. And I was talking about a team. You see, in a winning team, there is no loser, right? And there is no loser in a winning team, and there is no winner in a losing team. So if everybody works in the same direction, we pull in the same direction, we'll be better for it at the end of the day. All right, thank you. Over.
Thank you very much, Professor Wahab. I think we just have very few questions left. Okay, someone said, okay, Dr. Bankole said an insightful talk from our speakers and really value their time for this question. Thanks a lot, Professor Bankole, Dr. Essie. I really appreciate you. I think this is not a question. The next question is, what areas of neurosurgery do you think medical students should focus on in the early stage of their career?
Well, I wouldn't know if Professor Bankole is still on. That question will be better answered by him.
Okay, I think Dr. Essen, please, are you still on the call? Okay, I don't think Dr. Essen is still on the call. Perhaps we just reach out to our speakers and
to them, yeah.
Yeah, I'll reach out to them and I'll get back to you. If you ask the question, please just indicate on the group so that I can reach out to you when it's time. Then I think we have the last question. We just read it. Okay, for the last question, said, good evening, sir. Thank you for your presentation, sir. In a report released by the United States National Resident Matching Program for 2023, the mean number of abstracts, presentations, and publications for non-US international medical graduates who match into neurosurgery was 73.8. Sir, what are opportunities available for medical students to become as competitive as their counterparts in other countries in the area of publications of research papers? And how can students maximize these opportunities? And the second one is, sir, are you open to mentoring students who are interested in neuroscience, neurology, or neurosurgery in the University of ILORIN?
All right, so the second question, I'm very open and I have mentees even on this platform currently. And I have several other mentees in the College of Health Sciences. So please feel free to get in touch with me. I've already dropped my email address in the chat box. So please feel free to contact me, especially in neurology and neurosciences generally. And if it is something that I may not be able to handle, I will be able to refer you appropriately. But like I said, I'm very open to mentoring. Now, the first one about doing research, I think I've already answered that question because there was a question that was very similar to that earlier on. It's just to identify what you want to do, get involved, volunteer, go and observe, and then develop a research idea. Work with your mentor to develop the research idea and get it executed, get it published. Now, you may not even publish that, but you may present it at a conference. So if you have the opportunity of presenting your abstract at a conference, it can be used for such matching that you are talking about. So the opportunities are there. It's just for you to develop the research interest and then to have your research idea and then follow it through. I hope that answers the question.
Yes, thank you very much, sorry, Prof. Really appreciate your presence, and we look forward to learning from you subsequent times. That's all the question. Yes, you asked for the email. I think Prof dropped email before. So
yeah,
just check the chat box.
It's in the chat box. You want me to drop it again?
Yes, please. Thank you very much, sir.
Okay.
Dr. Banko, you did also. Thank you very much, Dr. Banko. Okay, over to you, Dr. Bankole. Sorry, can you hear me?
Yeah.
Yeah, I think is Dr. Bankole with us? Okay, so our next speaker is Dr. Daniel Popola, and Dr. Mustafa Fati will be reading a citation, sorry. Dr. Mustafa Fati, you can go ahead, please.
Okay, thank you very much for the opportunity. Dr. Daniel Popola, MD, PhD. Dr. Daniel Popola, MD, PhD, emerges as a luminary in the realm of neurosurgery, navigating a trajectory from the rural city of Ibadan, Nigeria, to the forefront of neurological advancements. Born with an insatiable curiosity amidst an epilepsy pandemic, his unwavering commitment to understanding the intricacies of the brain began with a bachelor's degree in pre-medical biology at Indiana University, Purdue, University, Indianapolis. His educational journey unfolded into a mosaic of disciplines, encompassing a master's degree in psychology and a doctorate in behavioral neuroscience at the State University of New York, Binghamton. Dr. Popola's quest for holistic comprehension extended to postdoctoral training at the University of Buffalo, culminating in a medical degree from the UB Jacobs School of Medicine and Biomedical Sciences. Currently, Dr. Popola is immersed in the rigors of residency training in neurosurgery at Montefiore Medical Center, Albert Einstein College of Medicine, Bronx, New York. His professional affiliations with esteemed organizations such as American Association of Neurological Surgeons and the Society for Neuroscience underscores his dedication to the advancement of neurological knowledge. Beyond his medical pursuits, Dr. Popola has etched a mark as a global healthcare advocate. He is founder of Success Clinic, a venture dedicated to enhancing global accessibility to neurosurgical care, particularly in underserved regions of the world. This initiative exemplifies his proactive stance in addressing healthcare disparities on a global scale. Dr. Popola's leadership roles are diverse as his medical expertise, from co-founding the Parents and Spouse Students Club to presiding over Camp Neuro. His contributions reflect a commitment to fostering collaboration and community within the neurological sphere. His involvement in Mission Brain Buffalo chapter further showcases his advocacy for comprehensive and compassionate healthcare solutions. A testament to his dedication to education and mentorship, Dr. Popola has been actively engaged in various mentoring and tutoring activities. His influence extends from peer education program at Jacobs School of Medicine to programs at Binghamton University, including bridges to the baccalaureate and the Louis Stokes Alliance for Minority Participation. Dr. Pupola's commitment transcends academic boundaries as he extends his mentorship to Binghamton High School. In the annals of neurosurgery, Dr. Daniel Popola stands not only as a practitioner, but as a trailblazer, an advocate, and also a mentor. His journey exemplifies the profound impact of mentorship and networking in shaping transformative careers and fostering harmony within the neurological community. Dr. Popola's biography is a testament to the potential for a singular individual to ignite change and leave an indelible mark on the landscape of neurological advancement. Ladies and gentlemen, give us the honor of welcoming Dr. Daniel Popola. Thank you all so much.
Can you hear me?
Yes, we can hear you. Thank you for joining us, sir.
Absolutely. Wow, that was an incredible cover letter you just read about me. It's humbling. Thank you everybody for being here. Let me know at any point in time if you cannot hear me, and then we can, do this a different way. So I always start my talks by, hey everybody, it's Dan the Brain Doctor. But officially my name is Daniel Oluwagbemileke Popola. I can say that very clearly because I'm speaking to Nigerians in the majority here. But thank you for the privilege to speak with you today. And I'm super excited about the potential outcome of this conversation. I hope that we can inspire each other and show each other the path to seeking and securing some form of networking or mentorship relationships in the fields that we are interested in. I believe mostly neurosurgery, neurology, neuroscience, and what have you. As previously said, I started medical school in Nigeria when I was 16. I went to University of Ibadan. I don't know how many people in the chat are from there, but I started my journey there. Along the path, my dad passed away, and so I lost financial support. I dropped out of medical school in 2007, and then I won the visa lottery, and I came into the United States. At that time, I came with $5 and a high school diploma, wanted to be a doctor. The journey was not smooth, but God has been faithful. And thank you, Mubarak Jalayami. Appreciate that. I also want to say thank you for the privilege to share this podium with the previous speakers, the esteemed Dr. Essen, Dr. Bankole, and Dr. Wahab. Thank you so much for such an incredible and insightful presentation. I think a lot of people have given so many PowerPoint presentations, and I'm believing that many of us on this platform are young and energized, and I think as a teacher for several years, I've come to realize that sometimes we have to, turn things around a little bit. So I want to have a presentation. I want to have a PowerPoint presentation. I want this to be more of an interactive session. So to ensure that, can anyone who is still listening, can we just drop something in the chat box and say yes, or hi, or hello, or raise your hand, or whatever you want to do. Let's do that within the next 30 seconds, please. Thank you. Hello, hello, hi, yes, hello, yes, hi, hi, hello, waving, hello, hi, hi, hello, amazing, whoa, woohoo. Good. Hi, everybody. Great. I'm really excited about this room. All right. This is going to be I know I have just about 30 minutes, but I want to make this as entertaining as possible. But thank you so much, everybody. Great to be here. Sweet. Hi, sir. Yes. Excellent. So we're talking about networking. And the reason why I established an online platform to teach neuroscience, teach neurosurgery, and also provide some mentorship and inspirational content is because personal story, and many of you may relate. I grew up in Nigeria. I grew up in Ibadan. We were very poor, but my parents saw in me that I kept saying I wanted to be a doctor, and so they went ahead to empower my dreams, and ever since I've been, all through my journey, I always reflect, I'm always thankful for the privilege to do what I do. I always remember people who are like I was when I was in my teens, who have dreams, who have potentials, but who don't have the resources or the guidance or the information necessary to, to catapult them from the dream stage to the realization stage. And my goal is to provide as much support, guidance, and help as possible. That is why I started the platform, the website called Success Clinic, and I dropped a link to the website in the chat box earlier, so you can go ahead and take a look at it and see a few things I have done, including podcasts and so on. I'm also on Instagram, Facebook, Twitter, YouTube. You can search all of those platforms for Dan the Brain Doctor. Dan the Brain Doctor, all one word. You find me there. Follow me so that you can get some more information, because I continue to provide more of those support. But then that leads us to the conversation today. So I want to give about 4 S's, 4-letter S's for developing and nurturing a strong and fortified professional career network. Again, 4 S's for developing and nurturing a strong and fortified professional career network. Number 1 is self-discovery. So the absolute first step in the process of becoming a neurosurgeon, a neurologist, or achieving success in anything you do is to first discover yourself and define your dream. Before you reach out to anyone for help in the field of neurosurgery, neuroscience, medicine, in anything you do, you need to have discovered your dream and passion. Every person that you reach out to, especially in the world of neurosurgery, the world of neuroscience, and I believe Dr. Bankole, Dr. Wahab, and Dr. Asen can testify to this. They will want to first know exactly what your goals are. That will be most likely the first discussion you will have with them. So my question for you is this. This is 2024. Have you written down your dreams and goals for this year? If you have, I want you to type in the chat box. Yes, no, there's no right or wrong answer, but I want to see how many people have actively written down their dreams, their goals, professional goals. Oh, I want to pass this board exam. I want to, develop this international connection with this researcher that I have heard about or I've seen their work and I'm super inspired by them. Or, oh, I want to, pass my board exam. I want to pass my clinical exam. I want to start this part of my journey. Good. Thank you for those who have responded. Yes, to be an SR in senior resident in neurosurgery, not yet. Excellent. For those who have not, it's still not too late yet. This is still January 6th. I think it's a very critical step towards success and creating a strong mentorship relationship for you to have a clear definition of your goals. And I'll tell you why. And let me share the story with you. So, on social media, I received several direct messages, several people reaching out. Some people send me scans, like CT scans, MRI scans, saying, oh, they've been suffering with this, that doctors told them to get this image and all of that stuff. But they don't understand. They don't understand the scan, and they want me to help. I do provide some help. I tell them that most importantly, they have to follow up with their doctors, but I give a little bit of insight as best as I can. But most importantly, some people reach out to me for professional support. And there was this young man, I don't know, I mean, according to the Instagram page, young man who reached out, casually and wanted to get some support. And I often will respond and say, oh, he said he wanted to get some professional career support. And I said, okay, tell me about yourself. Do you believe this person got back to me and saying, what do you want to know about me? And I don't have to tell you how the rest of that conversation went, but whenever you're reaching out to someone, to people who you think might provide some career or professional guidance to you, or when you're trying to build a network, you should always have your dreams rehearsed, your goals, your objective in your mind, that when they ask you, you should give them a response that leaves no doubt in their mind that you know what you are looking for, and every single investment of their time into your dreams to help you will be worth it. Do we understand? Can I see some yeses in the chat box? Okay, you're still excellent. Excellent. Thank you for those who responded. So that is exactly the reason why it's important for you to write down your dreams. Write down your dreams. Many of the people you're reaching out to for mentorship, networking, have an extremely busy schedule. They've been on 24-hour calls, or they've been in the lab for just several hours. And if they are gonna give that time to respond to you, you want to do your own part to be ready to convince them that that investment in you is going to be extremely worth it. Just like Dr. Bankole, Dr. Wahab, and Dr. Essen have said, that the first step is to define your goals. Now, when that is done, and I always know, as a believer, my watchword is in Habakkuk 2 verse 2 that says, write down the vision, make it plain on tablets so that a herald, a runner, or anyone that joins your circle can run with it. In other words, make sure that your dreams are very clearly written down somewhere so that everyone that comes near you can smell your purpose, your objectives, your dreams from afar. And so whatever they do will be in line with your dreams. Number two, I hope you're writing down. Number two is speak up. Speak up. I want you to make sure that whenever you have a dream, you actively pursue it by speaking up. Now, not necessarily speaking up to everybody and making noise, because professionals really also do not like a lot of noise. But you have to identify the people that can help that dream come true and open up to them. I'll share a personal story, actually 2 personal stories with you. Before I got back to medical school, I used to be a taxi driver, an Uber driver in the United States. But I always had my business card in the armrest. I always kept it there because I always knew what I wanted to do. I do not want to be an Uber driver for the rest of my life. I want to be a neurosurgeon. But at that time, I didn't have what it took. And I had a family, married with 2 kids, and I need to feed my family. So I was driving Uber and I kept my business card in the armrest. So every time I picked up a passenger, and I always try to have a great conversation with my passengers when I'm driving. And those who don't want to discuss, that maybe they want to rest or something, I excuse them from the conversation. But one of those conversations, I picked up somebody taking her to the airport. And I asked her, and we're having a conversation. At that time, I already had my PhD in neuroscience. And then she was, in the middle of the conversation, she said, "Oh, my daughter's boyfriend wants to go to grad school and then a PhD in neuroscience." And I was like, "Oh, actually, I have a PhD in neuroscience." And I picked out my card and I gave it to her. Apparently, this woman was an assistant vice president of a bank in Buffalo, where I used to live. And then she said, and I told her, I want to go back to medical school and be a neurosurgeon. She was like, "Actually, you want to be a neurosurgeon?" She said, "I have a friend who's one of the neurosurgeons in the city of Buffalo. Well, actually, I still had a drink with him a couple of days ago. I will reach out to him." And I thought, we ended the conversation. I dropped her off at the airport. I continued doing my, driving and all that stuff. I thought it was just one of those people that would just say things and that's it. To amaze you, the next day I looked at my phone and I got an email from her that copied this neurosurgeon in Buffalo. And she basically said, "Hi, this is Daniel. He was my Uber driver yesterday. He's a great guy. He told me he wanted to be a neurosurgeon. Are you able to speak with him?" That week, I had coffee with that neurosurgeon. Weeks after that, he invited me into his operating room. I was scrubbed in, and I began to observe surgical procedures. Few months after that, I got into medical school in the same city, Buffalo. But shortly after that, I was in the OR with him as a medical student. And today, by the grace of God, I'm a neurosurgery resident. That is the power of opening your mouth and speaking to the right people and having your plans and goals clearly defined and rehearsed in your mind, so that every single opportunity you have to speak with someone that may be, that can be a facilitator of that dream for you, you have all it takes to convince them that you are serious and you are ready to pursue this dream as soon as you have resources available. Does any one of us know what an elevator speech is? Yes, no? Chat box, please. Do you know what an elevator speech is? Great. I see many no's. We can discuss this. Excellent. Keep those coming. While we do that, I'm going to just tell you very briefly what an elevator speech is. I learned what an elevator speech is when I was an undergrad pursuing my bachelor's degree. I was interested in research. I reached out to, I knew my dreams, number one. I spoke up, reaching out to the offices and departments that could help me to start developing research. So for those who are planning to reach out to Dr. Wahab, I think it's a great idea for you to reach out. Excellent. Abdul Mujib Akbayami says, 1 minute speech to sell your idea. Exactly what we're talking about. Exactly. So I learned this at that time, and we were trained to have our dreams in research and career narrowed down to a concentrated 30-second to 1 hour speech. And the reason is this: You may be going somewhere. You watch movies where someone walks into somebody in the elevator and a connection establishes. Believe it or not, that thing happens in real life. Sometimes you will go for conferences, or you will be in the department, or you'll be in school, and you will walk into the elevator that is just going to the 10th floor. And inside the elevator, you will meet someone who you have been dying to meet for so long. Someone that can empower your dream. And they might by chance ask you, so what are you doing? Oh, wait, I have 1 minute before my next meeting. Can you tell me why you've been trying to see me? You need to be able to convince them within that 30 seconds to 1 minute of your dreams, what you've done that's prepared you for that dream, and how you think they can help you. 30 seconds to 1 minute. It's super important. And it's easier than you think it is, as long as you rehearse it. So again, it goes back to number 1, define your dreams. Number 2, be ready to speak up. And this number 3 point that I'm discussing, which is the elevator speech, the S for it is succinct communication. Succinct communication. You do not want to, many professionals are going from one meeting to the other, and the little time they have to share with anyone outside of their circle, they want to make sure it's extremely valuable. So if you want to earn that little 1 or 2 minutes of their time, you have to be succinct in your communication. You have to be very defined, and you have to rehearse that communication to ensure that you can convince them to schedule a longer meeting with you. I hope that's clear. Number 4 is stewardship. That is the 4th S, and I'll give you 1 extra S, and then we can take questions. The 4th S for developing a strong and successful networking relationship. As you're pursuing your dreams of becoming a neuroscientist, a neurosurgeon, a neurologist, or whatever you're pursuing, is good stewardship. Stewardship basically means when people commit things into your hands, how reliable are you with those things? Dr. Wahab mentioned this during his talk when he talked about you will be given projects. When you are given projects, how reliably do you execute those projects? I earned my PhD within 5 years, and I did some postdoctoral training as an assistant, as an associate professor. And some of the things that we look out for in students, in trainees, is how reliable are they in terms of returning the projects we give to them. If you're a student that you're given a time-sensitive project that should be delivered in a week and you take a month to deliver it, or should be delivered in a month and you take 2 months, and they have to start coming back after you, are you down with it? Many times the PIs, the principal investigators, the researchers don't really have that much resource to run after you for results or product of what has been committed to your hands. What they would do instead is just reassign that project to someone else who is more efficient. And when they do reassign that, I can promise you no other project will be coming your way. And that is because, as many of the prior speakers have spoken, there are millions of dollars that are going into this project, into this research projects, and productivity and producing results for those grant providing organizations is key. But if you show good stewardship, and when you're given a project, you take it to your heart and you deliver, it builds a sense of confidence in the heart of the mentor to say, okay, this person is reliable, I can commit a lot more into their hands. I hope that's helpful. And the last thing on this very brief talk is social media. So that's the extra S. So 5 S's in total. Social media. This might be more prominent in the United States, but when people apply for residency, almost everywhere, I can almost guarantee you 80% that people will look at your social media. Some people just put nonsense on the social media and they feel like it doesn't matter, especially if you are applying for a professional position or international position, international opportunities, like research fellowships after you're done with your with your medical school, trying to transfer from Nigeria or whatever country you are to the United States, the UK, or international world like Canada. Many times people have not met you before. When you reach out to them, one of the first things they would do is to search your name in Google. And if you go ahead right now and search your name in Google, and by the way, you can go ahead and do it right now, the few things you first see is either your Facebook page, your LinkedIn page, Instagram page. These are the things that pop up first. And when they click on it, whatever they see on those pages will be the first impression that they have of you. If what they see are publications, you being in the professional attire, you presenting the talk, you being in class, or you being in a professional setting, it inspires how they will respond to you, whether they would think you are really prepared for the opportunities you're seeking or for the assistance you're seeking, or if you're not. On the other hand, if what they see is just random post that doesn't have a goal or a dream, or a lot of times that could really cause them to withhold the support they intend to actually give to you. I hope that helps. So the reason why I'm asking you to do this is that I want you to, sorry, I'm trying to do something on my computer. So this is in the next 30 seconds. Whatever you do, I want you to have this mindset to create everything that can be found about you to be more professional, to be more geared towards reflecting your dreams, your goals, your ambitions, your potentials. Even if you're not attending conferences yet, I want you to take a professional picture and put it on your page. And I want you to do that today. I can see a pretty good picture for Gift Dansu here. I can see a decent picture for Abdulaziz Mogaji. I can see Joshua Mwanbali. I can see Marwa E. These are pictures that, and I can see also for Nuruddin Adeniran Bankole. These are pictures that I want you to have these professional pictures that people will see first whenever they type your name, whenever they try to search for you. It is extremely important because they say this thing. Sorry, I just looked to my first page. I could see something good for Boluwati Fair as well. Lucia, who else has a good picture? That's it. That's all I can see. I want, of course, Mission Brain has a picture. But I want you to do that. If that is the one big thing you would take away from this talk, even though I hope you take more from this talk, I want you to get a professional picture and upload it as a profile picture on Zoom, on Facebook, on Instagram, on whatever, LinkedIn as well, and Twitter. Whatever professional platforms you are, I want you to upload them because that is a picture that people will base your being upon, pending the time that they see you in person. And if you do not make that good first impression, that can deprive you of the potentials that you carry. So with that, I'm going to stop. I'm going to say there's so much I didn't talk about in terms of preparing for international boards like step 1 and step 2, how to go through medical school, how to several more detailed steps in securing mentorship. Unfortunately, that's something that we can discuss for hours, but make sure to follow me on my social media platforms. Instagram, just search for Dan the Brain Doctor, one word, Dan the Brain Doctor. And especially on YouTube, I do provide longer videos that teach more about how to gain admission to medical school here, and many of those other details I think might be super helpful for you. So follow me on those pages, subscribe to those pages so that we can have more conversations. I'm about to start a WhatsApp channel that really gears to this in more depth. So when that is created, people on my social media platforms will be able to know faster, and we can continue these conversations. At that point, I want to say thank you for listening, and if you have any questions, please feel free to ask.
Hey, thank you very much, Dan Debray, Dr. The real dope Dr. Daniel Popoala, MD, PhD. It was great having you here. I'm going to share your social media platforms to the group so that everyone can follow you and benefit from your content, as I've found them beneficial. So the first question I have here is, can one apply for observership in your clinic as a newly graduated doctor?
Thank you for that. So Success Clinic is not a physical medical clinic. It's an online platform that I created to provide both medical education as well as motivation, inspiration, mentorship, guidance. And I also do some podcast on that just to provide, it's like more of a place you go for emotional, mental, educational guidance. But with that said, I know I've worked in several institutions that have research fellowships available. I know that Mission Brain has some programs as well that provides international fellowship and observership in the United States. And I've seen several international candidates accepted for those fellowships who have traveled to spend time with Dr. Quinones or Dr. Michael Lawton or other institutions to get some research and observership experience. So that would be a path I would encourage that you pursued if you were interested in that. I know, like where I did my undergrad, there are as well several research fellows. Here where I am at Montefiore Medical Center, Albert Einstein College of Medicine, there are research interns. Many of them basically just finished their medical school and applied for opportunities to do research. They finished their medical school in whatever their home countries and applied for research fellowship in the United States. Many of them have not even written all the board examinations. So they've not written step 1, step 2, or step 3. Some, I would say, if you've written those exams, it puts you at a higher for higher consideration. People think you are more serious about what you're doing. And if they have grants and research fellowship opportunities, they will prioritize your application. I want to remind you that people believe Nigerians are super smart, especially in the medical world. So that is already an advantage for you. Again, people believe Nigerians are incredibly smart. So that is an advantage for you already. I want you, if you are willing to pursue such opportunities, take advantage of it and reach out, making sure that all of these points that we mentioned are nailed down. I hope that's helpful. And that is for
Yes.
Who asked that question?
Brain doctor. Sorry, can you hear me?
Yes, I can hear you, Mubarak.
Yeah, thank you very much, Dan the brain doctor. That was very insightful. So I think what we just have on the chat box is thanks. In fact, no matter how numerous it is, it's not enough to appreciate you because your session was so insightful. So I'll just read the next question. It says, neurosurgery in the US has been described as a very non-friendly or having an extremely high barrier of entry for IMGs to get into, especially with the recent study mentioning that matched IMGs had upward of 72 publications. Would you have any advice on how to navigate this? Thank you.
Whoever has that question, it's impressive. I'm impressed with that question because you didn't only ask a question, you actually did your research to get that question. That shows me that you are actively thinking in this direction, which is a great thing and gives you a benefit. And I could agree to you that the IMGs that match into neurosurgery in the United States are few, but it's not impossible. You know, in the United States, there's only about 1%, less than 2% of neurosurgeons are Black. But I'm here today, and I can count many other Black neurosurgeons, both in training and those who have already completed their training. The reason I say that is I want to remind you that because it's rare does not mean it's impossible. As long as you prepare yourself for the journey ahead, you understand the field and you figure out how to stand out. Many people are just doing it without having a plan. It's important for you to have a plan to execute. I know the average of people, the average of international medical graduates who are accepted into neurosurgery have high publications. You know how they do that? They do that through what I said earlier about you seeking research fellowship. Because neurosurgery is a world that involves a very, it's quite intense. We take care of the sickest people. People who have lost their consciousness, people who have a brain bleed, who are at the brink of death, people who have a subarachnoid hemorrhage, subdural hemorrhage, people who have spinal cord lesions, people who, people that have almost given up on their hope. And it takes extreme dedication. I will share this story with you. On New Year's Day, my wife and kids do not live with me here. But on New Year's Day, they were here. I was supposed to spend the day with them, and then they can fly back at night. I was supposed to go in for just 2 hours at 6 a.m. to round with the team and come back home. And then when I was there, within that 2 hours, within 1 hour actually, unfortunately, one of our patients who was admitted was having progressive weakness, and we had to go into the OR. That day, I was supposed to be back home by 9 a.m. I got back home at 7 p.m. Just 1 hour before my wife and kids were supposed to leave to go to the airport. That is the way that we have to accommodate for things that are unexpected. And neurosurgeons know that many people don't have the patience to go through this. That's why the program directors often look for people who have demonstrated beyond reasonable doubt that they are extremely passionate about neuroscience, neurosurgery, and this world before they are recruited. And for people who are in the United States, all through your 4 years of medical school, hopefully you've been tagging with the department and they've been able to assess you over time, over a few years. But there's no way to really assess the passion and commitment of someone who has not been in the country, who you've not really known. So a lot of times, the way for you to earn that trust and earn that that vote from many programs is for you to be a part of the team for a few years, many average of 2 to 3 years. And many times you do that by doing research with the department. And during that research, sometimes you get exposed to clinical environment. And then over that time, they're assessing how good you are. They're assessing if your credentials really speak truly of your capacity and your commitment. And many times, many IMGs that have successfully matched into neurosurgery have been those who have consistently demonstrated that indeed my credentials truly match who I am, match my potentials, and indicate and are truly a true reflection that I'm committed to this field. And believe it or not, several IMGs start that journey, and after a year or two, they just decide to go to other fields. And that is the reason why neurosurgery often likes to monitor for that 2 or 3 years to see your work ethic. And again, like you said, people that have 72 publications, it basically means they've been working tirelessly with the research team, with the entire team, to produce those publications. And those are the evidence that many of the programs need to see that you truly are devoted to this path. I hope that's helpful.
Thank you very much, the brain doctor. Okay, thank you for your very inspiring presentation. Is it late to launch a career in neurosurgery, starting with a master's degree in neuroscience and then research before residency at the age of 30 years?
Of course not. I got into medical school when I was 29. I hope that answers the question. And by the way, my co-resident, one of us started residency at the age of 43, which basically means he started medical school around the age of in his mid-30s. So it's never too late. Age is often not frowned upon when you're applying to this field. What they want to see is your dedication, your commitment, your knowledge, and your readiness to do whatever it takes to be a good neurosurgeon. So always throw the age outside of the window. Okay? I hope that helps.
Yes, thank you very much, Dr. Brain Doctor, for that insightful answer. I think the next question is, good evening, sir. I'm a third-year medical student. Concerning the first point, is there a place for being secretive about my goals and aspirations? I don't know if I'm just being superstitious, but I feel like maybe I could jinx my plans by telling a lot of people about it. Thank you, sir.
That's a great question. That's a great question. And trust me, I understand your perspective from being a Nigerian. I grew up in Ibadan. I grew up in the Rita Challenge Ibadan, and I understand exactly where you're coming from. I remember when I said that speak up, I said not making noise. You should speak up to people that you know you need have the resources to help you with the journey you are pursuing. You speak up to the people that can help with your path. And Yoruba would say something, they would say, Enudun Rofo. You don't want to just talk and not do. People like to see evidence of your productivity. In fact, it's often better for you to gather that documentation or that certification or those publications that prove that you truly are a researcher. I remember Dr. Wahab said, Dr. Essen, I think Dr. Hessen said something about Dr. Wahab. He said, Dr. Essen said, when I saw your name on the program, I went on PubMed to look for you, and I was impressed with your publications. That's exactly what people want to do. You don't want to be someone that talks, and have nothing to show for it. So don't talk too much. Don't talk too loud to people that don't really matter to your goal. Instead, be vocal just enough to the people that can help with your dream. And always make sure that there is proof that what you are saying is actually true. In terms of if you're telling someone you're passionate about the world of neuroscience, they should be able to see that you are either a member of the Mission Brain organization, not just a member, but an active member. It should show that you should see that you have, you've done quite well in your neuroanatomy. They want to see that you possibly have a publication or even a research presentation at a neuroscience conference or a neurosurgery conference, maybe even Nigeria. You don't have to travel out of the country before you have those. I heard some of the speakers talking about some conferences and some competitions that were held in Nigeria. Those are the things, are the events that you can contribute to and make sure they are in your resume. So every single time you approach somebody, you want to have an updated resume that supports every single word you say. That is how you don't jinx your chances. That's how when you say things, it's very helpful. I hope that helps.
Yeah, thank you very much, Daniel. We have another question here. The question is, thank you very much for the inspiring presentation. Okay, sorry, I'm just trying not to mute a question. Thank you very much for the inspiring presentation. As a medical student, how to get a mentor in an area, So let me try using my phone too. I'm not getting the full question on my
I think is that if that's a question from Buluwatife, it says, "Good evening, sir. I'm a third year medical student. Concerning this, the
No,
first
I
point,
think you've answered that. I've seen it.
Oh yeah, I see. Excellent.
How to get a mentor in an area without a neurosurgeon, basically. That's it.
That's from Joshua Uwambali. Great question, Joshua. I think the best way to do this is to reach out. There are so many people in several fields of medicine and science that are willing to mentor people. All you have to do is reach out. I mean, I have several friends. I've not been able to share my screen. If I was able to, I would have shown you several pictures. But you can also see many of those pictures on my Instagram page or Facebook page, where I have several. I have a whole team of Nigerian graduates who are pursuing master's, PhD here. Just about a month and a half ago, I was here in this new city of Bronx, where I just had like almost 10 surgery residents who are from Nigeria, who just came from Nigeria. About 10 of them were in my apartment here. And again, the picture is on my social media pages. What I'm trying to say is that many of them got these positions by reaching out to the potential mentors from Nigeria. They reached out to these mentors while they were still in Nigeria. So if you have this desires, this passion, this dream, I want you to pursue them actively. Look up the names or the contact of the people that you're interested in working in. Write down your dreams, like we said. Define your goals. Be very clear when you are describing why you are reaching out to them, and make sure you attach an updated CV that shows that you really have a history in the field of what you're asking for. And that usually will help you achieve the goal or dream that you are shooting for. I hope that's helpful.
Wow, thank you very much, Dan the Brain Doctor. That was so insightful, and really appreciate the fact that you gave us additional time. Can I go on to the next question? We are really sorry for delaying you.
No, it's okay. I'm very glad to help.
Thank you very much. So the next is, thank you for your presentation, sir. From your knowledge of the residency matching process in the United States, do publications and presentations in neurology and neuroscience in general have the same impacts as publication and presentations in neurosurgery proper in one's application? Then the second, what is more important in application for residency, a good USMLE score or having a good research publication amount?
Okay, we can answer those first two parts, and those are great questions, Israel, Abraham. I would say that publications across the field of medicine are helpful, but neurosurgeons also usually like to have presentations or publications in neurosurgery. So remember that the field of research, the president of the Congress of Neurological Surgeons, Dr. Elad Levy, he is the chairman of, at the medical school where at University of Buffalo, where I did my medical school training. And I was privileged to, have some, good conversations and relationship with him. And when people used to ask that kind of question, he would tell you that research across every field counts. Because there are a few things, many of the things we say about this process, we don't just say it. There's a reason why these principles are being followed for several years. The reason why a good research history is embraced in the field of neurosurgery is that neurosurgery is a very fast growing world. It's like lightning fast growing. And we know that over the next few years, there are some incredible discoveries that will be made. And we want people in this field who are willing, versatile to ask those critical research questions and to investigate them the right way, find the right answers, and be able to provide a good guidance, a good outcomes that can help guide neurosurgical care. We want those people who can think like a researcher to be neurosurgery resident and neurosurgeons so that we can always find those answers and advance the field. But you don't only you can be a physicist, you can be an economist and have that research skill. That's why the fundamental they want to see is that you have that research skill. Dr. Levy also used to say that in addition to having that skill, which makes any publication from any field acceptable, is the fact that research requires you working with a team. And if you're able to publish several publications, regardless of the field, it shows that you have a good track record of effectively working as a team member. And there's nothing more important in neurosurgery than being a good team member. That's why research in any field works. But while research in any field works, a person that has 50 publications in neurology and someone that has 10 publications in neurosurgery, the person that has 10 publications in neurosurgery might be given a higher consideration, because even though we know that you publish so much in neurology, you not having as much publications in neurosurgery suggests that you may not have as much passion in neurosurgery. I remember I told you that passion is one of the key things that we look for. I know somebody asked Dr. Bankole that question about passion. That was passion enough for you to, get into neurosurgery. So neurosurgery wants the passion for neurosurgery, as well as the work ethic and history of being eloquent in conducting research. So I hope to summarize the answer to that question, publications in neurology and neuroscience are super helpful, but neurosurgery will always appreciate if you have at least some additional publications in neurosurgery to show that you've also applied that research skill and expertise to the world of neurosurgery and you've succeeded with that. I had a PhD in neuroscience and behavioral neuroscience, by the way. And so a lot of my publications are in behavioral neuroscience, but I also have almost equal number of publications in neurosurgery. And that was about a good blend during my application process. Now, the second question is, what is more important in the application for residency, good USMLE score or good research publication? You need both. You need both Both are super important. There is a book called Greenberg. I'm looking in my library here to see if I have it close to me, maybe not close to me. It looks something like this. There's a book called something like this, Handbook of Neurosurgery, but it's a smaller one that is meant for people who are aspiring to be in neurosurgery. That book will tell you about why research is quite important, but neurosurgery wants people who are high scoring in the USMLE to show that you have that academic capacity to hold the rigorous educational demand in the world of neurosurgery, because we use terms that almost no one else has used. We map the brain, and you need to know every fissure, almost every artery, every branching, the pathway. It's like you mastering the GPS of the entire city of New York. That's something that requires some academic and educational competence. And that's why the scores are super important. In fact, the field of neurosurgery and orthopedic surgery in the United States are one of those that used to have the highest USMLE Step 1 score requirement to be even considered for an interview for the residency. Number two, in addition to the USMLE score, they also want to see that research competence. I hope that's helpful.
Yes, thank you very much, then the brain doctor. I think we have two final questions here before we call it a day. So the first is, what did you say was your personal cutting edge in your applications for residency in the United States? Aside publications, does having a master's degree and PhD in neuroscience improves your chance of getting a placement when you don't have up to 72 publications?
Sorry, I'm trying to respond to someone in the chat box. So several people have been asking for my email. I would redirect you to my Instagram page for now to direct message me. And the reason I'm doing that is from there, I can keep the contact information so that I'm about to create that WhatsApp group, WhatsApp community. I can always just redirect you there, and every question can be directed there. I hope that's helpful. I'm sorry, my email is just super cramped. And I have several of those, and I don't want to delay you. People can reach me better through DMs and WhatsApp messaging than through email. I hope that's helpful. I'm sorry, guys, if that's a little uncomfortable. Sorry, Dan.
Okay, should I go again with the questions?
Yeah. So I think the question you said was, aside my publication, does having a master's degree and PhD in neuroscience improve your chances? Yes, it does. The more degrees you have, often the better, but it doesn't guarantee you a spot. I hope that's helpful. It helps, but it doesn't guarantee success. So there's a lot of things that program directors will consider and departments will consider in the recruitment process. Of course, they're impressed with additional degrees, masters, PhD, and many times for international students or international IMGs, a good thing you can do is actually come in for a master's or a PhD degree. I know several people in neurosurgery, in orthopedic surgery, and cardiovascular cardiothoracic surgery, who are those are some of the most competitive fields in medicine here, who come in to earn that additional degree, because it helps you, like I said, to build that relationship with the department so that you can prove your ethic, your values, and to prove that you are committed to the dream, while you're also earning that additional degree and building your publication portfolio. So it often helps to have those additional degrees, and it will indeed be given more favorable consideration, in addition to the other factors, which include letters of recommendation, which are super important. letters of recommendation. Neurosurgery does not, and just to digress, neurosurgery programs here in the United States rarely will accept any letter of recommendation that is not from a neurosurgeon in the United States, or at least an extremely prominently known neurosurgeon globally. And you need about 3 to 4 of those letters for your application. That is another reason why people who are interested in neurosurgery will do a few years of research position, either as a research fellow, and many times the research fellowship positions are paid positions. So if you're coming in for that, it's not that you're going to be working for free. Many of those are paid positions, or getting that additional degree, graduate degree. I hope that's helpful.
Yeah, thank you very much, Dan the Brain Doctor. I think that's all about the questions we have. And I'm going to send your socials to the group so that those that are interested in contacting you will do just that. And we look forward to learning from you in subsequent events. Really appreciate your presence, your time, and the additional time you give to us. Thank you everyone for joining, and we are going to be sending a post-conference survey. So if you have not joined the group, try as much as possible to join. And the pre-conference survey has been closed, like I said. Over to Dr. Bankole.
Okay, thank you very much. This was a great session, and I really appreciate the effort of all our speakers to take the times to answer almost all the question of the participants, and that it is a very, very great session. I hope that the young colleague here will develop more interest for neurosurgery, and it is the honor also to meet again a senior colleague and friend, Ignatius Essene, Professor Femi Bankole, as well the 2 last speakers, Professor Wahab and Dr. Daniel. I wish his story was very, very, inspiring. That sincerely congratulations, Dr. Daniel, and I wish you to finish your residency, and your story will impact a lot of young colleagues here. So thank you for coming. Thank you for accepting the invitation. And thanks to the president of Mission, Brian, who is my mentee, which invites me to moderate this session. It is a privilege and honor. Thank you very much. And I wish everyone a good evening, and I hope you enjoy well this session.
Yeah,
and, have a nice weekend.
We have one more speech, please. I'm sorry about that. I don't know if you got the message I sent. So it's just like a vote of thanks from our vice president. So James, you can go ahead, please. Thank you.
Okay. Go ahead then.
Good evening, everyone.
Good evening.
Good evening. Okay. My name is Adedoyin James Adeyemi, and I am the vice president of Mission Brain Ilorin chapter. So as we conclude this momentous virtual gathering, I extend my heartfelt thanks to each of you who contributed to the success of the inaugural Mission Brain University of Ilorin Conference. Our deepest appreciation goes to Dr. Alfredo Quinones Hinojosa for his visionary leadership with Mission Brain Foundation, paving the way for neurosurgical advancements in underserved regions. A profound thank you to our esteemed speakers for sharing their insights, making this event an enlightening experience for all in attendance. To our attendees, your presence and engagements have added vibrancy and diversity to this virtual space, creating a dynamic atmosphere for the exchange of knowledge and ideas. A special acknowledgement to our organizing committee for their tireless effort, dedication, and passion in bringing this event to fruition. As we navigate this virtual landscape, your commitment to the future of neurosurgery in Nigeria is truly commendable. Let's carry the spirit of Mission Brain UNILORIN forward, staying connected and inspired. Thank you all for being part of this historic conference. We look forward to future engagements as we continue our mission for improved neurosurgical care in Nigeria. Safe journeys in your virtual travels, and until we meet again, warm regards, James Adedo. Thank you very much.
Thank you very much, James, for that amazing vote of thanks. I think, Dr. Bankole, do you have anything to add? Perhaps to aspiring neurosurgeons like us?
Okay, no, I don't have anything to add, just to say thank you for this great session. And yeah.
All right, thank you everyone for joining. Please don't exit the group. We're going to send post-conference surveys, updates on certificates, and we're going to be hosting amazing events like this so you can benefit from it. Have a nice day, everyone. Thank you for joining us. Goodbye.